I can't hear you. You're muted.
Just awaiting for Mr. Piyush Kaushik, sir. I'm just calling him.
Is he joining us, or I think we can start with
Yes,
the
sir.
permission
Meanwhile,
of the
I'll call
Senior
him.
Vice President? I think I can see him, Mr. Piyush Kaushik.
Okay. Okay, sir.
Lucia?
Yeah,
Yeah.
yeah. Good morning, and thank you for joining us. So with the permission of our Senior Vice President, Mr. Pradeep Multani, and our Chair of the Health Committee, Dr. Subramanian, we start.
Please, please.
A very good morning to all of you, and wishing all of you a very, very healthy, prosperous 2021. And the word healthy couldn't have had a better or a bigger meaning than what it has today. And all those who are on the screen and maybe off the screen also, the attendees, are all related to this sector. And I think we must give kudos to all the doctors, all the frontline health workers, the entire health community, I would say, whether it's the manufacturers of pharma products or medical devices, the entire health community, a big round of applause for, the way we have tackled COVID-19 so far and been successful in containing the spread of that. So a big round of applause for, I think, all the health community. And special thanks to all the doctors and the frontline workers, health workers. And let me take a moment to thank Dr. Sameer Gupta, who has been working on the front line, and of course our chair, Dr. Subramanian, doctors in profession, handling cases on the ground. So I know it's been a very, very tough time for all of you there. With this, I'd like to welcome you all once again. I can see Mr. Pawan Chaudhary joining us. Good morning, Mr. Chaudhary. Thank you for joining us.
Good morning, Vivek ji.
Good morning. This is a series 2 of the webinar series, which we are doing as a mandate from the Ministry of Chemicals and Fertilizers, Department of Pharma. And they have tasked us to make a roadmap on medical devices as an industry. So we had the first webinar in late December. This is the second in series, which is titled Web on Innovation and Incentivization of Indigenous MedTech Manufacturing. And there'll be 2 more happening in the series, which will be in February, post which we will be submitting a roadmap to the ministry in March 2021. I'd like to thank Mr. Pradeep Multani, Senior Vice President, PHDCCI, for joining us, Dr. N. Subramanian, Chair, Health Committee, PHDCCI, and Director, Medical Services, Indraprastha Apollo Hospitals, Dr. Sameer Gupta, Co-Chair, Health Committee, PHDCCI, and Director, Cardiac Cath Lab Metro Group of Hospitals, Mr. Sanjay Gupta, President, ASEMA India and MD, Mars Edpal Instruments Private Limited, Mr. Piyush Kaushik, Head Healthcare Innovation Center and Business Leader, Philips India Limited, Mr. Atantra Das Gupta, Director, Southwest Asia Head for Samsung of the Health and Medical Devices sector, Mr. Pawan Chaudhary, Chairman and Director General, MTAI and Managing Director, Vigon India, Mr. Saurabh Arora, Head of Tax, Asia Pacific, Siemens Healthineers, I think if I pronounced it correctly, and Mr. Sunil Khurana, CEO from BPL Medical Technology. We also have with us Dr. Manish Diwan, who's the Head of the Strategic Partnership and Entrepreneurship Development at IRAC, which is a part of the government and the ministry. We will be joined by Dr. Jitendra Sharma, who is currently attending a meeting with the Secretary Methi, which started at 11 o'clock. And we are hoping to also see Dr. Iswar Reddy, Joint Drugs Controller General of India, CDSCO. So with that, I think, impressive list of panelists and a very, very important task at hand, for us to venture into so that we can give the directions to the industry and seek the support of the government through this report. Without much ado, I'd like to request our Senior Vice President, Mr. Pradeep Multani, to kindly give his welcome remarks and the presidential address. Over to the Senior Vice President, Mr. Multani.
Thank you, Mr. Vivek. Good morning. Welcome to the webinar series, Self-Sufficiency, Atmanirbhar Bharat in Medical Technology. The series 2 focuses on innovation and incentivization of indigenous MedTech manufacturing. Our panelists of the session today are Dr. Jitendra Sharma, Dr. Manish Diwan, Mr. Pavan Chaudhary, Mr. Sunil Khurana, Mr. Saurabh Arora, Mr. Atantara Das Gupta, Mr. Piyush Kaushik, Mr. Sanjay Gupta. I would also like to welcome Dr. N. Subramaniam, Chair, Health Committee, PhD, and Director, Medical Services, Indraprastha Apollo Hospitals, Dr. Sameer Gupta, Co-Chair, Health Committee, PhD, and Director, Cardiac Cath Lab, Metro Group of Hospitals, and today's session moderator, Mr. Vivek Saigal, Assistant Secretary General, PhD. Ladies and gentlemen, PhD has been working as a catalyst for the promotion of Indian industry, trade, and entrepreneurship for the past 116 years. It is a forward-looking, proactive, and dynamic pan-India apex organization. As a partner in progress with industry and government, PhD Chamber, with a special focus on MSMEs, works at the grassroots level with strong national and international linkages for propelling progress, harmony, and integrated development of the Indian economy. Having evolved significantly in the last decade, the Indian MedTech industry is witnessing a high growth trajectory. But due to a number of ecosystem constraints, this industry sector has not been able to achieve its full potential. The recent policy changes initiated by the government to create a predictable and enabling ecosystem are expected to set the ball rolling to make India a powerhouse in manufacturing of medical devices. Talking about the innovation to foster any medical device innovation, we need market push and technology generators such as trained manpower to generate ideas, funding opportunities for nurturing the idea, intellectual property protection, infrastructure to seed the IP or technology into a company setup, and tax incentives policies for ease of doing business. Today, India offers a unique and dynamic platform for nurturing medical device innovations to transform ideas into reality and recognizing the immense growth potential of medical device sector. The government of India has identified the medical devices industry as a sunshine sector for the Make in India initiative. Since 2014, India has witnessed numerous fiscal initiatives and policy changes which led to the development of a robust and enabling ecosystem for this sector. To realize the full potential of MedTech sector, the government has taken several steps and policy initiatives, including initiatives to facilitate ease of doing business, tax incentives to boost domestic manufacturing, 100% FDIs by MNCs, predictable regulatory regime to boost confidence of investors to develop quality medical devices, and setting up exclusive infrastructure facilities, etc. Currently, the Indian market has high reliance on imports, but in recent times, the exports have seen a surge. Atmanirbhar Bharat mission is providing an impetus to India's vision of becoming a global manufacturing hub for medical devices, and recent initiatives, for instance, the production-linked incentive scheme and promotion of medical devices park schemes are a testimony to this. The PLI scheme for medical devices will help meet the objective of product diversification and production of innovative and high-value medical devices in India. These initiatives have the potential to contribute significantly to achieving higher objectives of affordable healthcare in the country and globally on a sustained basis. Considering the immense potential of the medtech industry and the kind of support given by the government, fostering the innovations and indigenous manufacturing will be a way forward for India to become a self-reliant, self-sufficient in medical technology. Today, we have the eminent speakers from the industry and policy regulators from the government to discuss the role of medtech innovations and government support in terms of industrial incentives and infrastructure support to make India not only self-reliant, but also the MedTech hub for the world. Ladies and gentlemen, on behalf of the PhD Chamber, I once again welcome you all and look forward to your active and valuable participation in this important session. Thank you. Jai Hind.
Thank you very much, sir, for those directions and the warm-up which you have given us, not only for the webinar, but also a heartfelt welcome to all our speakers. I must acknowledge here that Mr. Multani actually runs a more than 80-year-old company which is into Ayush products. And Ayush products, as we all know, have done a great job, with the advisories coming in from the Ministry of Ayush to build up the immunity of the Indian citizens. And during this time, a lot of Ayush products also got exported. So I must thank the entire Ayush sector, which you represent, sir, for doing all this favor, I would say, to the industry, to the general citizens by making them a lot more immune through Ayurvedic medicines and kadas. Thank you.
Thank you, Vivek.
Thank you, sir. Thank you so much. And I really appreciate your joining us, sir, today. Thank you for your time, sir. I'd like to now request Dr. N. Subramanian, who's the chair of the Health Committee at the PhD Chamber of Commerce and Industry, and also the Director of Medical Services and at Indraprastha Apollo Hospitals. I'd like to also acknowledge, before I hand over the mic to Dr. Subramanian, that we have been joined by Dr. Harvinder Popli, who is the co-chair for the Health Committee of PHDCCI. I'm glad, Dr. Popli, that your meeting got postponed and you are able to join us, though you were not scheduled originally in the program. But we are glad to have you here, Dr. Popli.
Thank you. Thank you so much, Vivekji.
Right.
Thank you.
Over to Dr. Subramanian, please, for his
Namaste.
opening.
Thank you, Mr. Saigal. Senior Vice President Multani, I think, gave a wonderful overview of our need for the self-sufficiency going forward on innovation and incentivization of indigenous MedTech manufacturing. We are all aware that modern medicine and the advances in modern medicine are so much dependent on technology, consumables, newer drugs, and devices. We know that our current import of equipment and devices from 5 of the top countries alone exceeds $3,500 billion. While we move forward, India has a very large population, and we know that the patients to doctor ratio is going down. And we also happen to be the world capital of coronary artery disease and of diabetes. So we really need to focus on prevention, early diagnosis, minimally invasive treatments, and the ability to predict outcomes and provide excellent follow-ups. During the COVID era, we have also realized the importance or the value of telehealth platforms, telemedicines, home care, home sampling, and so many other things. Going forward, let us look at the areas which are very, very important to us in terms of the medical devices and equipments. We know that currently we are about 86% of, we are import dependent for almost 86% of our medical devices and equipments, despite excellent skills and excellent setups in our own country today. Now, I wanted to just look at some of the areas where these are of great value. We know that when we look at the increasing incidence of these common conditions that I mentioned, and increasing prevalence of cancer throughout the country and beyond, there are several devices, either in treatment or in diagnosis, which are of great value, be it the radiology and the imaging devices, including the nuclear medicine devices, Similarly, the value of various radiotherapy and associated equipment and devices. Similarly, the safety in anesthesia, safety in cardiac, safety in respiratory conditions has progressively be dependent on high quality medical technology and equipment. And we are constantly innovating and increasing the quality of these devices. So we know that the outcomes from people in the ICUs, as we discovered recently during the COVID era, the outstanding results that we had were dependent on the excellent quality of supportive equipment in the ICUs. Similarly, people who are on kidney failures, depending on dialysis, depending on transplant, depending on immunosuppressants, and all that again depends a lot on technology, a lot on equipment, a lot on devices. When we move forward into the common areas like cardiology, for instance, all of us are familiar that the role of the stents in making people lead a completely normal life when they have had problems with coronary artery disease, or the artificial valves which have helped people with valvular heart disease. Even going forward, people who have problems with their heart blocks and heart rhythms, we have the various pacemakers, etc. For babies and children who are born with difficulty in hearing, who will be helped to grow into completely normal adults with normal education, etc., with the support from areas like the cochlear implants, etc. These are all areas where, from a completely impaired or a disabled life or lack of life to progression to a completely normal education, normal productive life, we can make an entire difference. I understand that we would expect in the next 5 years that our expected incremental production would be to the tune of around 69,000 crores. In addition to these, you and I know today that the value of artificial intelligence in predictive strategies, the value of 3D printing technologies in terms of creating new prostheses, etc. The value of the Internet of Medical Things in integrating devices and the IT systems. And in addition to that, also the wearable devices like the HMDs and the special watches, etc. I think the count is endless, but the purpose is the same. The purpose is to have a minimally invasive approach and a preventive approach to a much healthier India, not only in terms of physical health, not only in terms of mental health, but also in terms of economic health. So I must welcome all the participants who I see are such eminent speakers, and I must thank the Secretariat for putting together such a comprehensive and well-designed program. And Vivek, Saurabh, Ravi, I think I must thank you all for including me as a part of this wonderful panel. Thank you so much.
Thank you, Dr. Subramanian. I think very clear outlines on use of technology, IoT, disease burden of non-communicable diseases, the NCDs as we call them, like cancer or heart ailments, are very, very key to the medical device sector, I would say. That brings in, of course, brings me to the renowned cardiologist, Dr. Samir Gupta, who is also the co-chair of our health committee of PhD chamber, and also the director, as I said, of the cardiac cath lab on the Metro group of hospitals. It'd be great to hear from you that what would you look at, from the medical devices industry going forward in the next 5 to 10 years. And we have one of the major manufacturers sitting here, I think, listening to you. Apart from Mr. Sanjay Gupta, I must say that Mr. Sanjay Gupta actually represents about 400 medical device manufacturers of Ambala, and he chairs this. He's the president of the SEMA. So we have large and small manufacturers listening to you, Dr. Gupta. So it'll be nice to hear from you. What do you look forward to in terms of innovation for this sector? Over to you, please.
Thank you so much, Mr. Sehgal, and I would like to welcome all the panelists and all the speakers today. And thank you for having me. A very warm welcome to everyone. So, the Indian healthcare market was estimated to be about $35 billion in 2007, and it has been witnessing a double-digit growth in the last recent years. Now, this growth is fueled by demand from major cities primarily, but now the tier 2 and tier 3 cities, healthcare delivery is also improving. There's kind of a paradoxical healthcare delivery in India. At one point, we are the hospital for the world. We have best-in-class healthcare. But on the other side of the spectrum, there is challenges of accessibility, affordability for a major part of the population, especially in smaller towns and rural areas. We are facing multiple challenges, Indian healthcare, not just in the doctor-to-patient ratio, and I'm speaking from a healthcare professional and healthcare delivery standpoint right now, not just from the doctor-to-patient ratio per capita, but also infrastructural challenges and other challenges, like including technology. Now, but let's be clear, technology is vital in delivery of healthcare also. And tremendous strides have been made in medical science and technology over the past many years. Now, when you compare it to 1947, when we got independence, India's life expectancy was 31 years. And today that expectancy has doubled to almost 70 years. And this is only because of innovation in the MedTech space. And when we talk about MedTech, we don't just mean digital, which everybody's talking about, and it's come out because of the pandemic. But technology, MedTech also means healthcare products like devices, equipments, consumables, reagents, like the previous speaker, Dr. Subramanian, talked about, the CT scan machines, the chemicals that are used. Everything encompasses MedTech. Now, as an interventional cardiologist, let me give an example. The treatment protocol for an acute myocardial infarction or a heart attack in the 1960s in major hospitals in America was rest, oxygen, and morphine, because that's all we had. Today, when a patient comes to me with an acute heart attack, we open the artery up immediately. Within 90 minutes, the artery is open, and we send the patient home in 2 to 3 days. We use technology that has been developed only over the last 20, 30 years. And this is all because of innovations in the MedTech space. And I must thank all those companies and our speakers today for making that possible. Whether it's the cath lab, which is made by Mr. Arora Siemens, or Mr. Kaushik's Philips cath lab, or I'm maybe using a defibrillator made by Mr. Khurana. It's all because of these technologies and innovations over the last 10 to 20 years, 30 years, because of which we are able to treat patients better, make them live longer, because at the end of the day, health is wealth. But these improvements in MedTech, these improvements in the treatment come at a cost. Now, every day when I treat patients and operate on them, there's a big challenge that these patients face with finances, and often they're scrounging for bills. And this situation is not just in India, it's also in America, where healthcare expenses are one of the primary causes of bankruptcy. And it's not just affordability, like I said. Accessibility, awareness, availability are all other significant challenges that are being faced. Now, the PMJ, the Ayushman Bharat scheme that is launched in September 2018 by the Honorable Prime Minister Narendra Modi is the world's largest state-funded health insurance scheme. Now, this scheme aims to reform the Indian healthcare sector by providing free secondary and tertiary healthcare services to major parts of the country, and it's going to take the country to new different heights that we are all looking for. But with time, we should mitigate some of the challenges. With time, this should mitigate some of the challenges, not just of affordability, but also accessibility, availability, and awareness. Now, as a doctor and also a medical director of a hospital, As you all know, and also the speakers over here, the MedTech industry leaders, they realize that the major challenge in this scheme is the reimbursements. The reimbursements are a major challenge, and they are kind of cost prohibitive, especially when you want to provide quality care. So the question comes up, how can we mitigate these challenges? And the answer lies in innovation. This innovation has to be both in healthcare delivery and MedTech to try and provide the world-class healthcare that we want to provide to our citizens. And this innovation need not only be restricted to products. Business model innovations across the value chain, whether it's manufacturing, distribution, marketing, etc., can often generate significant benefits to the stakeholders, including the patient and end users. This past year has made one thing very clear, that if anybody can innovate, it is us in India. The current pandemic has converged the entire medical industry and academia in a never been seen before momentum. It has led to mass production of innovative medical products, along with awareness of diagnosis and diagnostic tests that will help improve the quality of healthcare in the future also. From conducting 1,000 tests per day to 9 lakh tests per day to detect symptoms of COVID-19, India has showcased immense potential to become the global producer of supplier for quality indigenous medical equipment and technologies. I can quote another example. I was invited to be a judge at the final round of the Smart India Hackathon in Chandigarh. Engineering students from all over India were showcasing different healthcare products they had been working on. Whether it was a non-invasive way of checking your hemoglobin, nobody likes being pricked, so they had developed a sensor by which you could check your hemoglobin. Or it was an affordable prosthetic limb, or even a product to improve X-ray quality of traditional machines. I was amazed by the energy, the talent pool that this country had to offer. An effective and innovative use of medical technology has potential for increasing access, significantly reducing the burden of disease, and load on healthcare delivery systems through early diagnosis, better clinical outcomes, less invasive procedures, and shorter recovery time. As a practicing interventional cardiologist, as a medical director, I completely understand and I know that affordability is very important. It becomes very important in India. Over the last 4 to 5 years, with the stent costing ban that has been placed, so many new indigenous companies have come up, which are at par with international technology and are now developing indigenous products for use which can be given to our citizens at international standards. Now, I know India is an emerging economy with the highest startup pool globally and is ideally positioned to be a leader of the MedTech innovation. India has a large talent pool of qualified professionals, essential for building novel products that address unmet healthcare needs of the country. Through the right policy measures, financial access, and public-private partnerships, India can emerge as the MedTech innovation hub for emerging markets and affordable MedTech globally. The pandemic has reminded the world that we are the pharmacy of the world, but let us also show everyone we are also the MedTech capital of the world. I think Mr. Siegel is logged out.
Yes, actually my connection went off. I wonder if you can hear me.
Yes, we can hear you now.
Okay. So there was a problem with Wi-Fi at the office, so they're just rectifying that. So thank you very much, Dr. Samir Gupta. Highlighting what I could hear was loud and clear. Reimbursements are challenges. And we need a lot of innovation, not only in products, but along the value chain. I think a big message going across to all of us there. So with this, first, let me invite, we are usually known as a chamber for the MSMEs. So I'd like to give the first privilege to Mr. Sanjay Gupta, who is the president of ASEMA and the MD of Mars at Instruments Private Limited back at Ambala. And let me give you a brief on what we did in Ambala and how did we get across. So PhD Chamber had actually run a series of workshops along with NID, which is the National Institute of Design at Ahmedabad. And we had identified close to about 15 clusters within these 400 manufacturers of medical devices. Ambala has been the home to microscopes all over the country and probably to the world too. So these 15 15 clusters were given the expertise of NID designers to design their own products. And there were 5-day workshops, which were inside and outside the classroom. When I say outside the classroom, they were actually held at the manufacturing units of these small MSME manufacturers. And PHDCCI spearheaded this for all the manufacturers across these 15 clusters in Ambala. And that's how we worked very closely with the small manufacturers of medical devices back there with the help of SEMA. So with this little background, Mr. Sanjay Gupta, over to you.
Thank you so much, Mr. Vivek. And a very good morning, Chairman Dr. Subramaniam, Co-Chairman Dr.
Samir Gupta and Dr.
Samir Gupta, Mr. Vivek, Mr. Dr. Ravi, all the panelists and members from various industries and organizations. First of all, I convey my heartiest gratitude for providing me an opportunity to be a panelist. As you said, self-reliant and self-sufficient India. We all wish that India should be self-reliant in medical technologies, and we have seen during pandemic how India fought and won this battle. It shows that we have tremendous potential to be self-reliant. And as all of us know that Ambala is famous for its scientific instruments, and there are more than 2,000 micro, small, and medium scale units engaged in different activities. That, as Mr. Vivek said, that around 400 people, 400 entrepreneurs are engaged in medical technology and medical devices business. But at Ambala, we are manufacturing medical instruments for first year medical colleges, second year medical colleges, and main instruments comprises of our laboratory apparatus, microscopes, heating and cooling instruments, histopathology lab instrument, and most of the instruments are low to medium level technology. I can say that at Ambala or even at India, basic sciences exist, but technology does not exist. This I'm saying about Ambala as well as India, because if we take the example that India is a big hub of software. All big companies, TCS, Infosys are in India. They are making software for all over the world. But what we are doing, we are making software, we are supplying to the probably the 5 countries mentioned by Dr. Subramaniam, from where we are getting the $300, 500 billion instrument. We are importing around that much amount of instruments from there. We are supplying software there for their instrument, and we are importing back those instruments with our software. So our software is going there, and we are taking the complete instrument or the instrument as a part to complete our instrument. So we are sitting at a very lower edge of technology as far as the medical instruments are concerned. So major requirement to develop more instruments at Ambala is we should have a lab with optical technologies, having good electronics, embedded systems, image processing facilities there, so that we can design our instruments at our own with good quality designers. In North India, complete North India, if we see, we have only 2 institutes having optical infrastructure, where we have designers and optical technology. One is at Dehradun and another is Chandigarh CSIU. So we, and if we see the innovations, as Dr. Smear said, that we need to innovate. Most of the innovation nowadays are coming through optical instrumentation. Most of the things are coming through optical instrumentation. And in optics, India is very back. We are doing well in software. We are uh, doing pretty well in electronics. But as far as optical instrumentation is concerned, we are far behind than the rest of the world. So we need to develop optical infrastructure with good designers, good designing facilities to develop medical instruments at large scale. I can give you one or two examples, like MRI machines. Maybe one or two manufacturer worldwide. Dialysis machine, one or two manufacturer worldwide. Not to talk of India. Not to talk of India. Only one or two manufacturers are ruling the entire world. As far as MRI machines are concerned, as far as dialysis machines are concerned. So if we have to make India self-reliant, we have to develop these things, not the MRI machine or dialysis machine, but middle level of instrumentation at India. Because such a big chunk, if we are, if it is going out, like Dr. Subramaniam said, that $3,500 billion imported are the imports we are doing for the medical instrumentation. So Ambala industry have a strong base of entrepreneurs, but they are lacking technological inputs. They are not having good labs, not support system. If we get good support system, definitely we are in a position. Our entrepreneurship can is in a position to develop good level of instrumentation for medical instrument and make India self-reliant. That's all I want to say about this. Thank you so much for giving me a chance.
Thank you. Thank you, Mr. Gupta, for definitely giving in your suggestions on optical technologies where a lab is typically required, and a lot of need for middle level instrumentation to be made. And I'm sure that a lot of the big manufacturers sitting here could actually see Ambala as a back-end manufacturing hub for smaller components and other things going forward, given the technology which can be given and shared with this cluster right close to the heart of the country, the capital city of the country. So that's really nice, and thanks a lot for sticking to the time. Now I'd like to invite Mr. Piyush Kaushik, head for the Healthcare Innovation Center and business leader from Philips India. So over to you, Mr. Kaushik. A lot of innovation happening back at Philips. I think your tagline is innovation for you. So love to hear from you.
Thank you, Mr. Vivek. And I'm really very honored to be here. And thank you all the panelists, especially Mr. Multani, Mr. Subramaniam, and also especially Dr. Sameer Gupta, who shared with us the real customer story. Because in the end, if I talk about Philips, Philips is a service provider to our customer who are like Dr. Sameer Gupta and our patients. And that's where the innovation come into picture, that how we are able to innovate and provide the right solution at the right point of time with the right pricing. With that, I would like, before I jump into, of course, the great topic, I'm coming from an engineering background, as Dr. Gupta indicated. There are more than 1,300 engineers in Pune and more than 4,000 engineers from Philips in Bangalore, approximately 5,500 engineers working and developing innovation and solution for healthcare industry. And there, they are not only working for global, but at the same time, they are also working to provide solution for local, for India market. And also similar to India, other emerging market like India. And there, when I am so in Pune, especially, which function I lead, is it has both innovation and manufacturing. So this topic is really hard to very hard hard to me, but basically talking about the core of what we do every day. If I really talk about India, as an opportunity, it has a huge opportunity, and I believe we are taking advantage of it. However, we are taking small baby steps rather than taking a big steps. And for example, I'll take a example to compare with Ireland. Ireland is a country with a major medtech hubs. They host 18 out of world 25 medtech firms, and they export 12 billion of medical product every year. And they have, of course, that Ireland as a medtech, or they have the number of different points. Perhaps the most important of that development is IDA Ireland. It's a government body designed to stimulate export-led business throughout the country. Now, if I really look at when we are doing and looking forward the solution, Make in India is definitely one, but at the same time, Make for Global from India. So we got to look at also both localization and indigenized product, but at the same time, how can we make India more proud worldwide? One of the challenge I want to share with everyone of here is that when we are making manufacturing in Pune and exporting worldwide, we export from North America to China everywhere. We face the challenge as a tagline of the quality. Oh, it's coming from Make in India. What will be the perception of quality? So what we did, we fixed that as a foundation, and we become the benchmark in Philips, of course, an industry from the quality perspective. So from the brand value and quality perspective, Philips also, of course, focus a lot, but Pune especially came out very strong and forefront of the whole organization. So with that quality in mind, and we are now exporting globally so many products and also developing product for India, I would like to pay attention to really take this from where we are to the next level, to the opportunity, on very crucial topic of here as incentives. If I really look at to really take to the next level, we have definitely many incentive in past, and I also know they are currently going on. For example, MEIS, SEIS, these are great examples. Unfortunately, they have been stopped in 2020. And I know there is a proposal and replacement by RODETP scheme. However, there I could see that their clarity of structure and notification start coming very recently. It is not yet implemented. So as on today, we don't have the incentive which we have been enjoying in past. And Philips, for that matter, I'm sure there are other organizations, and I can see here, many of us as part of India, we are trying to attract business to India, local for local, but at the same time for global business. And to help that, these incentives are very, very crucial. And what I really see the core of those incentives and the benefit, I could see that a lot of good benefit of a core component manufacturing. However, this also need to be extended to the assembly, because in the end, we should not only focus on making the manufacturing component, but we should also focus on complete product end to end in India. To make that happen, there are very less incentive for complete assembling of a product from the incentive perspective. So, and of course, there are many other opportunity we have, like from Ireland as an example I have given, from the incentive to be given. So would like to really put this attention to everybody, and all industry and government, speakers are here, and focus on that part so that we can really drive this Make in India, not only for India, but for global. That's it from my end. Thank you, and back to you, Mr. Vivek.
Thank you, Mr. Kaushik, for highlighting that no more baby steps. Let's take a quantum jump. Quality becoming an issue when you are actually trying to get things over from uh, China or other places. Um, I'm sure Mr. Sanjay Gupta is hearing this and will try and encash the opportunity, of people like Mr. Kaushik and companies like Philips not going to China for component level sourcing or other sourcing of products. So, and I'm sure if I can say on your behalf, Mr. Kaushik, you'd be ready to also share technology with smaller manufacturers to help them manufacture for you. Is that right?
You're muted, Mr. Kaushik.
Can you hear me?
Yes, I can hear you now.
Sorry about that. This technology is always that's becoming number one tag. We can't hear you. You are muted. Yeah, I forgot to add one more point. Our focus is also developing local supplier. If I really look at industry, there is a huge industry base for automotive or heavy engineering base. There are many suppliers, and India has taken a very good step on that front because we have been there for hundreds of years. But when I look at the medical devices and look at the medical devices, because it's a low volume industry, there are not many players in the supply chain, and that's where Philips is working with a lot of local supplier and partners to develop them to really get the benefit also beyond only making the product.
Okay, great. So, and of course, the point which you highlighted, that the incentives have stopped, so we need a lot more clarity and a lot more quickly. So, thank you, Mr. Kaushik. I would like to now quickly go to Mr. Tantradas Gupta, the Director for Southwest Asia for Samsung Health and Medical Devices. Samsung is a big player. We all know that, a giant of all sorts into consumer durables, white goods, and everything. And of course, a lot in the health and medical devices. So I'm sure I also know that you're investing a lot in India with the recent investment commitments in UP on the on the white goods front. So, yeah. So, Mr. Gupta, I mean, what would it take, for example, Samsung to invest a little more on the medical devices front and the kind of innovation which you'd like to do, maybe have more engineers, is what we would like to hear from you. Over to you, please.
Yeah, thank you, Mr. Saigal, and thank you all the esteemed members of esteemed panelists. I like to say Samsung is working on an ecosystem in the healthcare front. We are not only limiting ourselves for medical equipment, but also we are coming up with a digital health products with our wearables and in mobiles. Because what we have understood, and this is a phenomenon worldwide, not only in India, in case of preventive healthcare and the primary healthcare in India, we spend around 6% of our budget. And 56 to 57% of the budget has been spent on the secondary and tertiary healthcare. So what it is affecting? It is affecting that we are not able to build up the infrastructures, and also we lack in the preparedness in facing the bioterrorism or the pandemic which has happened recently, where we have to go into a longest lockdown, which has affected our economy very, very badly. So the primary healthcare is also the need of the hour. When we are looking at the healthcare as a whole, the primary healthcare needs urgent attention. And now, as Dr. Subramanian said, the ratio between the doctors and the population is going down, but it will take some more time. Today, from 0.7 to 1,000, it has come up to 0.8 to 1,000. So the huge gap still lies. Hence, the digital intervention is required not only in cities, but also in villages and rural areas to bridge the gap. Today, if we look back to socio-materialism theory, where the human and non-human actors came into being, the digital space will also script out a new theory in order to bridge this gap and provide a quality healthcare. Dr. Subramanian just mentioned about the $3,500 billion of imports and also the prevention and early diagnosis. So this part is very, very important. What we need to prevent? What are the areas we need to look into before getting into MRI and CT scanners? Yes, CT scanners and MRIs are very, very important. If we look at the life expectancy and the disability index going on, which is the DALI, the disability adjustment life year, which is a summary of YLL and YLD, the years of life lost and years lived with disability. This is going to be very important for us because our life expectancy has just been doubled. Dr. Samir Gupta has pointed out from 35 years to 70 or 71 years. So what are you going with this aging population? So we need to look at HALE, which is healthy life expectancy. That is, they expect to live with a good health. We have to look into these parameters to improve the healthcare of the aging population, because this is going to be another burden on our economy. And in order to restore, in order to have a healthy population, we have to give more importance to our primary and preventive healthcare. Dr. Samir is here, and he will vouch for the golden hours, where if the diseased person or the heart attack person has been treated early, there is a chance to survive. Apart from getting into the MedTech, the most premium equipments, which are also into, we should get into the diseases which are pondering us. What is the biggest, which disease or cost us the highest money? That is the malnutrition and diarrhea. The Swachh Bharat Abhijan is there, but we can also act into it and try to come up with innovative solutions. The small areas need to be looked into. And yes, in coming back to Mr. Sanjay Gupta's appeal of the bigger and the higher equipments, we can tie up with our world-class educational institutions, IITs, engineering colleges, to come up with solution. In the recent past, Mumbai IIT has developed a MRI with an indigenous solutions. Not only that, the applications which are related to Indian populations can be developed. We are the software capital of the world. We should harness our expertise in softwares and build up Indian specific applications. Today, AI, ML are throwing us an opportunities, a huge opportunities to us. We can have a database on our own instead of becoming a cheap source of database like the testing laboratories in India. We should look into it. And I think the PHDCCI and the government can play a stellar role in stopping the exploitation of the data, because the future is software is a medicine. Thank you.
Thank you. Thank you, Mr. Tantradas Gupta. I think a lot of wonderful points, and especially that you're looking at this as an ecosystem, the healthcare as an ecosystem, which you're trying to develop with digital health and wearables. And of course, the need to focus on the primary and the aging population, primary healthcare and the aging population. I'd like to now invite Mr. Pavan Chaudhary, Chairman and Director General MTI and Managing Director of Vigon India. So I have known Mr. Chaudhary. I hate to call him Mr. Chaudhary. If I can call him Pavan as one of my old friends. So we've known each other for quite a few years, and it's been great knowing you. Tell me, what do you feel? Where do we need to go from here now to innovation and for incentivization of the indigenous MedTech industry? Over to you, please.
Thank you, Vivek, and thank you, Mr. Multani, for having us here. So, what I would like to say is that there are three pillars of inpatient healthcare, which every hospital owner will tell you. Every hospital owner or medical superintendent will say that inpatient healthcare depends on hospital infrastructure, quality of human resources, and medical technology. So medical technology is really miracle technology. And today, medical technology's importance has only increased because the medical devices of today are not only straddling the domain of healthcare, they are co-straddling the domain of geopolitics, of defense. We had the opportunity of meeting with the Prime Minister for about 2 hours at his home. And it was quite clear that he understands that an implant which is there in the brain or a heart implant is vulnerable to a cyber attack. Any hostile nation can have, or any hostile actor can have can go for a cyber attack on these products in mass. So it is very important, not only from healthcare point of view, but geopolitical independence point of view, for every country to start thinking of either making these products in their own shores or going for associations of co-manufacturing with countries which have long-standing peace, similar political dispensation with them, and which cannot be pushed over by a rival. For example, India then becomes a very good candidate for any Western multinational to choose as a destination to manufacture their products in Asia. Out of all the Asian countries, India is the country which has a democratic, peaceful past with most Western countries. And it has a very strong candidature that it can resiliently hold its own against any push from any rival of the Western powers in Asia. So this is one of the areas which we should look at in the current scenario, where we should be ready to attract companies which are leaving countries like China to set up their manufacturing here in India. Why? Because medical device manufacturing requires a very robust ecosystem of mechanical skills, electrical produce, hardware, software, clinical and regulatory domains. So in mechanical, in electrical and electronic spheres, we are quite strong. In software, we are quite strong. The mechanical prototyping, where you require intricate metallurgy, is not so strong. And the hardware piece is also not so strong. Clinical and regulatory, we are strong. So my fellow panelists from Ambala and as well as from Philips have already spoken very well about this requirement. And I would like to make it more granular and tell the audience as well as the policymakers who will join us that we need attention here. So this is one part of the piece. The second part is tax incentives, etc., which we spoke of, not only for manufacturing, but also for R&D. So that this in India becomes attractive not only for the Indian entrepreneur, but from entrepreneurs from all over the world, just as Ireland did some time back. Also, we should be aware about the changing landscape of healthcare. Very well, it was shared by the previous panelist, Mr. Ratantra, that the digital piece is changing the landscape of healthcare. Epicenters of health are changing and diversifying. Earlier, the epicenter of health was the hospital, but today the epicenter of health is also the home, as the pandemic has shown us, and as telemedicine has made possible. One of the companies in which my family is invested, Blue Circle, has done a research, and it has found that telemedicine has meant more than just the digital convenience for patient. The patient, of course, has saved money, saved time, saved himself from the risk of infection, but also he has one more reason why 5 crore of them came on telemedicine or digital platform in the first 3 months. And twice they came for 8 minutes each. So 10 crore people came. Why they came? One of the other important reasons, Vivek, was that they felt they are not going to lose their dignity in this interaction. They felt, the interviews clearly told us that They feel that the arrogant healthcare worker or the arrogant doctor on occasions can can rob them of their dignity. They don't want that. And then when Blue Circle went and did a similar survey on e-commerce, they found that poor people have really taken to e-commerce in a very big way during the pandemic. And the reason deep down was this again, that for they had to dress up well before going to the shopping center or the mall, and they were not sure how the fellow shoppers and the shopkeeper will behave with them. They were not behaving so well with them, so they decided to buy from the privacy of their homes. So we have to be aware of this also. The entire landscape is changing, and just to talk about how medical technology sector has to adapt to this. Telemedicine, for example, what Atantra spoke about, is good for the patient for the reasons I said, is good for the doctor because he has cognitive support, he can handle his waiting room pressure better, he can handle more people. It is good for the payer because the costs will come down. It is good for the government because the discrepancy in demand and supply of nurses and doctors can be reduced. So it is good for everybody. That means this omelette cannot be broken back into eggs. This genie is out of the table, is out on the table. It cannot be put back into the bottle because it helps so many. The only similar example which I remember, which an advancement which came and which helped so many people, was Henry Ford's assembly line. When Henry Ford came with his assembly line, it reduced the cost of the car. It increased the wages of the employees. It reduced the total number of hours which the employee had to spend, worker had to spend, and it increased the profits of the employer. Which means what? It was so helpful to so many people that it became the biggest attack on communist ideology. Communist ideology was defeated not through capitalist ideology, but through examples like this. So telemedicine is telling us something. It is saying to us that the patient wants not only great care, he wants it at his home, in familiar surroundings, conserving his privacy, conserving his dignity, maybe also bringing greater accuracy, because some medical devices at home work better than they work in the hospital. For example, a blood pressure monitor. It has been found that blood pressures taken at home are not biased by white coat hypertension. The blood pressure goes up when there is a lot of hospital-like atmosphere, people are a little agitated, nervous. So we need to look at the whole piece holistically. Are we doing enough on the demand side and the supply side? And are we aligning our commercial ventures to the rising opportunities, to the changing landscape? And then create the ecosystem, the financial ecosystem, the technological ecosystem, the regulatory ecosystem to attract medical device manufacturing and incentivize it in India. So this is the path which we should take and go on illuminating this path as we walk forward so that we are resolutely and enduringly in a good place. One of the colleagues spoke about Indian quality. Piyush spoke about Indian quality. Yes, this is also very important. We should not rush so fast that we cannot create an image of enduring quality. We have to go in a deliberate manner so that we are known as a country which supplies quality and not suddenly jump the gun and spoil our reputation, which might be difficult for us to that spoilage might be difficult for us or might take a long time for us to correct. So this is what I would like to say. And thank you very much for having me with you all. And it was a big pleasure being with all the fellow panelists and so many audience which is patiently listening to us, which is reflective of its enthusiasm, and their questions are reflective of their informed status. Thank you.
Thank you. Thank you, Pavanji, for, in fact, I think taking on further what Mr. Atantra Das Gupta was talking about, the health ecosystem, the, uh, the entire medical technology being more like medical technology. And I think a very important point on the security aspect, which you brought in, which also needs to be delved into going forward, if we are especially making the roadmap. At this point of time, let me welcome heartily and thank Dr. S. Iswara Reddy, Joint Drugs Controller General of India, CDSCO. A very, very good afternoon to you, sir. And I know you had a very, very busy schedule. I think the entire CDSO has been running day and night for the past 10, 11 months. But thank you so much for joining in.
Thank you, Vivek. Thank you very much. I will remain present in the next 2-3 sessions. I think you have up to 12:30 this session, so I will be in this session. I think as and when the term will come, I will have my vote that time.
Okay, I just wanted to say, sir, if you are in a hurry, we can change the schedule.
No problem. You can go ahead as per the schedule. No issue. Okay. Please go.
So I'll just quickly brief you. We had our Senior Vice President, Mr. Pradeep Multani, giving a warm welcome. And then we had Dr. N. Subramanian, who's the Director of Medical Services from Indraprastha Apollo Hospitals and also the Chair of the Health Committee of PHDCCI, speak after that. And we had Dr. Samir Gupta, Co-Chair of the Health Committee, speak. And then we also had Mr. Sanjay Gupta. Mr. Sanjay Gupta has been representing the ASEMA, the 400 odd entrepreneurs which are there in Ambala cluster for medical devices. Of course, we had Mr. Piyush Kaushik definitely raising the point that, no more baby steps. I think we should take some large steps, big steps now to take the leap in the medical technology front. Mr. Atantra Das talked about, the entire digital health ecosystem, which needs to be worked upon, and he's looking at digital health and points related to wearables, where he feels the technology should go. And he also emphasized that primary health and the geriatric healthcare are going to be the two focus areas, which I think India needs to focus on when it comes to, GDP spends and other private spends on healthcare. Let me go back to what Mr. Piyush Kaushik also talked about, something very important. He talked about quality, and he talked about incentives getting stopped in the MEIS and the CEIS, and new notifications just coming in. But what he said is maybe we should do this faster and with a lot more clarity. And we just finished hearing Mr. Pavan Chaudhary from Vigon, and of course representing MTI. And he talked about, as I said, not medical technology, but medical technology, and brought in the security aspect of, the solutions which we need to create around medical technology. I think one very important examples which he gave was that the implants in the heart or the brain are susceptible to attacks, by unwanted elements. So he brought in the security point of view again, where innovation is really required. So, sir, just to fill you in, this is the second series of the webinars which we are doing for making a complete report on the roadmap for the medical technology industry for the Ministry of Chemicals and Fertilizers, as mandated to us by them. So we will be holding 2 more webinars on after this. And after these 4 webinars, we are collating the report and presenting it to the ministry as to where does the medical technology industry need to go, what are the government initiatives and thought process which are required. And I'd like to share that only as recent as yesterday, this is for information of all, we also had a talk with, I was attending a meeting wherein I was invited by FICCI, and FICCI has also decided to join hands because they're also making some joint presentations to the Ministry of Chemicals and Fertilizers on this front. So they will be also joining hands on, making a very concise and a complete report so that it reflects a 360-degree view of what we can do. So that's the quick brief, Dr. Reddy. With your permission, now I'd like to request Mr. Saurabh Arora, Head of Tax, Asia Pacific for Siemens Healthineers. It was important to get in a professional with the tax and incentives calculation background, into this webinar to give us a insight as to where do you see us going. Over to you, Mr. Arora.
Yep. Thank you. Good afternoon, all. Thanks a lot, Mr. Siegel. I think all the eminent panelists and speakers have quite beautifully articulated and touched upon all the relevant aspects, I think, which are the need of the day today. Maybe I'll complement their thought process. Maybe not be able to add something new, but I'll try and give a equipment supplier's perspective, right? How do we see it, and maybe also touch upon something relevant that's being done in tax policy as well in last 18 months. So I think if we look at the tax and the policy changes, which has happened in last 18 odd months, and couple it with various fiscal and non-fiscal measures which have been taken to boost manufacturing and investment, I think clearly what government has done or is doing is quite remarkable. I think be it rationalization of corporate income tax rates down from 35% to 25%, and further down to 17%, in case you float a new domestic company for manufacturing, is very, very competitive if you compare it with any other large economy. Abolition of dividend distribution tax, in the recent budget by the Honorable Finance Minister also made it very conducive for non-resident investors. Or be it like production-linked incentive schemes for medical devices, pharmaceuticals, electronic components, and semiconductors, which try to address the competitive disadvantage that Indian manufacturer has today, either for want of well-developed domestic ecosystem or supply chain. At the same time, what I also believe is there are quite a few relevant aspects which we should not lose our sight of, right? The first one being India is not the first mover who has introduced these incentives, right? These incentives make a very honest attempt to place us at par with the operations with other competing economies. But we may still not have a clear competitive edge in all the spheres and streams that we talk about. And specifically, if we talk from a medical device perspective, localization of medical device is clearly very high up on the agenda and radars of most of the governments in the world today, specifically after the pandemic. And in that context, we may see an increase in the intensity of implementation of these measures. Something similar to what India has implemented. Could other countries may follow suit, and there are many who are already doing that. So in this context, what I believe is, while it is important to have these measures because it provides a level playing field, and we know that there is a dearth of ecosystem in India as we speak. But at the same time, I think it is very, very important for us as a country to also very effectively play our USP of potentially being the biggest market for medical device in the world. Because with measures more or less similar to what India has introduced, I think for any investor, the size of the local market will play a very dominant role. Now, I'll just give a perspective, and if I compare us with China, right? It's a known fact that both of us together, India and China together, cover almost 30 to 35% of the global population, with 17% represented each by India and China. But if you look at the size of the medical device market, we are not even 1/10 of what China is. If you look at the potential, it's almost the same because we have equal size of population. China medical device market still growing at around 20%, well over 100 billion mark. Already we are roughly around 10, $11 billion. So I think demand stimulation is something which would play a very critical role if we have to give a boost to what we are trying to do. And clearly, if I look at demand stimulation, both affordability to healthcare and accessibility to healthcare becomes relevant there, right? When we talk about affordability, uh, if I compare again India with other competing economies, right? Out of pocket expenditure for India is quite high. It's roughly around 65 to 70%, right? Whereas China is almost half of what India is. And if you compare it with other countries like Japan, it's below 10%. Now, and that too, if I look at out of pocket expenditure in India, almost 70% of the out of pocket expenditure comes from outpatient treatments, right? Whereas all the government sponsored schemes or medical insurance like Ayushman Bharat, they primarily try to cover the inpatient expenditure that happens, right? So there is still we are significantly underinsured, no doubt, but then I think we also need to see through the overall structure of how this assurance or this expenditure could be covered up. As far as accessibility to healthcare infrastructure is concerned, I think we need some impetus and focus the way we as a country has given on road infrastructure, right? With almost 800 PPP projects being announced already, we constructed almost 4,000 kilometers of highway in the first half of the current fiscal, right? I think we need that amount of that war footing urgency to create the infrastructure. We all know that the dearth of doctor to patient ratio, or number of beds to the population ratio is far below, what WHO guidelines are. And government's expenditure needs to really go up, 3% of GDP, whereas if you look at OECD average of around 9%, I think clearly there is a lot of catching up that we as a country need to do there, right? In addition to demand stimulation, I believe, I think I would echo what Mr. Pawan Chaudhary and what Piyush as well from Philips said in the context of R&D incentivization, right? Because we all know innovation precedes manufacturing, right? And more likely than not, you would find R&D center or innovation hub always being co-located with a global manufacturing hub, because there are a lot of operational and technical synergies that you would find if you have them co-located in one campus. And in that context, I think it should not be restricted only to hardware design or component. It should also be extended to all the digital technologies that we talk about, be it artificial intelligence, because we all know that healthcare as a sector is growing quite rapidly with huge volume of data being created and increased number of challenges on patient outcomes and cost. And these technologies are already playing a significant role in empowering health service providers in improving and so that they could deliver services with greater degree of precision, both in terms of diagnosis and treatment, besides improving the clinical workflows, right? So I think be it hardware, be it digital, I think there is a need to incentivize R&D, because I believe India has huge talent, huge talent in terms of to scale up the operations, and can also not only orchestrate, can also lead this digital transformation globally for health space, right? And there is always a stiff competition. I represent Siemens. I know there are captives which we have to fight with against to prove our worth in terms of quality and in terms of cost as well. And I think these incentives go a long way, in trying to get a decent size of shift in business from competing economies like China, Europe, US into India, right? And I think the last bit from my side would also be ecosystem, developing a very sound ecosystem. I'm aware about the PLI schemes that just got rolled out for manufacturing for electronic components and semiconductors. I just hope we are able to achieve the objective that we had set out for ourselves through these schemes, and with development of local vendors and ecosystem, clearly the decision to shift decision to have device manufacturing in India would not remain that difficult as it is now. That's it from my side. Thank you.
Thank you very much, Mr. Arora. I think uh, you brought in the important aspect of actually comparing what we can do in India vis-a-vis what is being offered in rest of the world. In terms of whatever incentives or measures they have been taken, being more or less the same. We need to differentiate with our um local demand, to be able to be up in the ante of the investors. So very, very important point, and of course the demand stimulation, wherein you talked about um, affordability and accessibility, and yes, the ecosystem. Just a quick line, if I can have from you before I go to the next speaker. What kind of incentives, R&D incentives, would you look at being a numbers professional, to help our ante again with the investors, if I'd like to say so.
So I think there were quite a few incentives under Income Tax Act. If you look at Section 35 to AB, there was a weighted average deduction. There was a sunset clause. I think March 20 was the end to that, wherein they reduced the weighted average deduction was 150%. It got down to 100% then starting April of 20. We had SEIS, I think what Piyush also indicated, which incentivized on the foreign exchange earnings. I think there is, and I'm not too much influenced by the US challenge as well to the WTO on certain Indian schemes to promote incentives, but SEIS was not part of it because it doesn't form part of the SCM agreement that India has signed. But SEIS, even if government believes SEIS may not continue in the same form and fashion, our desire and request would be at least deserving services like R&D should continue to be incentivized, maybe in some other scheme. Maybe DOP could come up with a scheme which focuses on R&D in med space, or health space, right? And which we may not definitely, or for all practical purposes, link it to a scheme floated or regulated by Ministry of Commerce. SEIS, MEIS were more schemes regulated through the foreign trade policy by Ministry of Commerce. Maybe that cannot be. We can have a more focused scheme, just to take care of the nuances and the difficulties that we have in health space.
So, any quick number you'd like to give on the incentivization for R&D in terms of percentage?
It could be comparable what we have had for SEIS. SEIS provided for 5%, and some years it was 7%, but somewhere around the same range would help, because there are already approved business plans, wherein we had factored in that, and then it helps to have that certainty as an investor.
Thank you. That gets me my answer. If I can take the permission of Mr. Sunil Khurana to first invite Dr. Manish Diwan, because he has to leave by 12:30. Is that okay with you, Mr. Khurana?
All right, no issues.
So kind of you. So Dr. Manish Diwan, Head Strategic Partnership and Entrepreneurship Development at BIRAC. I'm sure he has a lot more to, throw light on in terms of, how BIRAC is helping and how BIRAC can further help the small and the large manufacturers on innovation and even incentives. I think he'd be a good person to put some light on that. Nice to have you, Dr. Manish Diwan, and over to you.
Many thanks, and thank you personally, Dr. Sunil, for prioritizing me over in the speakers list. Thank you, Mr. Vivek. I think a wonderful discussion and very insightful from all the speakers, and it was heartening to see an echoing of the thoughts that there are recognized gaps in the ecosystem, and all industry players, users, givers, providers and enablers perspective, that these gaps need to be addressed, and there are opportunities which are sitting along with these gaps. I think more all of us in one way or the other said that about 80% of our current requirement of medical devices, equipments, consumables, we are dependent on imports. And that's like the pieces which are now available as products. So as direct such products. We are not talking about the products that could potentially be developed to address and bring under our fold the 65% of India's population, which remains in low resource setting, where these technology adoption is still a large gap. So that's second gap where what we are seeing is only about 10% of the population is actually uh, under a fold where they are able to take and adopt, and the healthcare delivery is more structured. Rest of these people uh, who can't afford high-end healthcare services are still yet to receive that kind of similar treatment opportunities. uh, the third aspect I would also like to highlight is that COVID days. Imagine hospital industry, which is the sole provider of the healthcare. That industry took a huge hit in terms of their revenues and turnovers in these COVID days. Simple reason, because we are very much dependent on in-person healthcare delivery, right? Uh, the COVID days have given uh, a kind of recognition of the gap that remote consultation, distant telemedicine is a reality and must be adopted. So the technology adoption at the healthcare provider end, that has also been recognized, and I think very quickly we've been now seeing that all major hospitals, tertiary care centers, private hospitals have started giving remote consultation, and telemedicine has now become a reality. And as Mr. Saurabh was just mentioning, some previous speakers, that more than 10 crore consultations were done in telemedicine because of this recognition in these past few months. So there is a so what I want to emphasize is that as soon as we realize that there is a gap, the ecosystem quickly responds back and uh, and and gives a tangible and logical solution. One more example I would just put in front of all of us, that when the COVID struck, we did not have COVID diagnostic kits. We were actually sending samples right in the early March and Feb to US just to get tested whether this person has been infected with COVID or not. Now we are in a position that we are manufacturing uh, lakhs of diagnostic kits in house and then exporting it to. And this journey quickly emerged from importing the components of these kits. Initially, the kits which were licensed outside India, we were importing and then reselling. Then we started making those kits, and but components of those kits were still being imported. And now what we have is 100% indigenized kits, diagnostic kits, and then we are deploying it at large scale as well as exporting it. And the cost of those kits kind of reduced from 5,000 rupees to now 200 rupees. So there is an immense opportunity and a possibility that we can respond to such situations. So what can we do uh, as a collective effort? I think from the industry part, I think we heard many of our colleagues, and there is an intent that there is technology adoption intent, there is facilitation, engagement with the small, medium enterprises to facilitate manufacturing, to scale it up. Uh, but the next piece where newer technologies can emerge and then integrated into the health tech. That's one piece where I would also like to bring in attention here. So from an enabler perspective, BIREC and DBT have been providing direct funding to innovators and startups to come up with new ideas, new innovations that can be developed as tangible product proof of concepts. And once these proof of concepts are there, and there is a network of incubation centers where these innovative ideas can thrive and breed, a place where industry, investors, stakeholders can come together and see what mentoring, go-to-market strategy, what relevant product portfolio fit can emerge from these innovations and can be adopted as a cherry pick format. So a pipeline of such innovators from the talent pool across India, incubation centers where these ideas can be nurtured, funding provisions where these ideas can be progressed from technology readiness level of 1 to, let's say, 3 to 5. Post that, I think these ideas need to now scale and scale to the context that from POC to grow to manufacturing stage, early manufacturing stage. Now, the early stage startups would not have capacities and deep pockets like large industries for the high capex investments. And unless they demonstrate that their innovative ideas have uh, uh, have been tested, let's say, clinically validated, they would not be able to attract a sufficient interest from industry as well as from investor to help them grow forward. So this missing piece, that's a gap if we talk about ecosystem as a whole, not talking about some bright exceptions which still steer through and steer through in a slower pace, but a large gap where this POC to manufacturing journey has been hit. Recognizing this, we had proposed creation of setting up of technology clusters in the country. The idea is that we would provide a POC to pilot facility, which is technology propellers, and pilot to early stage manufacturing in the manufacturing zones. So these two components of technology clusters would help steer and provide a exponential movement for innovative ideas to move from POC to the manufacturing stage. The individual startup, if they want to, let's say, create 50 copies or 10 copies of their medical device, they really can't go to large industry to get it manufactured. If they want to manufacture themselves, they would need capex investments as well as entire bandwidth of what development would require for that device. If they go outsource it to a manufacturer, they lose the inherent advantage of frugality as well as affordability. So these technology clusters would help them, and these would be common facilities with the right infrastructure designed for manufacturing, raw material inflow, vendor base, uh, the certifications, the investors coming here, industries intertwining, an ecosystem in itself where we would have these startups as well as SMEs to come and utilize such facilities with bringing in their talent, raw material, and going out as a with a ready product. AMTZ is one such example. I think Dr. Jitendra Sharma, if he's coming on board, he might give a on ground feel of how this one such example of technology cluster has emerged. Imagine if we have 10 such technology clusters across the country. We heard about Ambala, for instance, where we are creating a large large presence of MSMEs. Uh, such technology clusters, if they could also cater to provision of raw material, the components of creation of these medical devices in-house in the country rather than being dependent on imports on that. So imagine uh, these facilitation would bring together our existing large industry, medium scale industries, as well as international players. And I think many of our colleagues are here who already participate in such innovation ecosystem, but at a smaller scale and smaller commitments. Once we structure it in a larger fashion, at a with a scale, there would be opportunities where we can have national as well as international players getting more closer to the innovation ecosystem. And not only this would reduce our import export imbalance for the existing known medical devices or consumables, but we would also be able to create and unleash an untapped opportunity of much larger numbers of, say, point of care devices, devices which can work in low resource settings, uh, as well as consumables and equipments which we can replace uh, based on our requirements. So there are provisions, funding, uh, innovation challenge. For example, one of those were just rolled out as Jan Care, which where we have many of our colleagues present here as industry partners. So such innovation solutions, what we are saying is we will provide opportunity for them to get clinically validated in PHC levels, Anganwadi levels, where they are being operated by unskilled people, yet they will be able to link up with the tertiary care centers for remote consultations and bringing the healthcare delivery to the last mile. So these efforts collectively need to be supported and taken forward. And I think with the right intent and maybe PhD chambers, who is now working on writing a guidance note or a recommendation note, may consider some of these thoughts and emphasize it further so that we all come on a same page and work forward in that direction. So I'll pause here, Mr. Vivek. Thank you very much for having me here. Thank you.
Thank you. Thank you so much, Dr. Manish Diwan. Lovely hearing you. And of course, all the talk which you have given on what kind of, I think something very interesting is the technology clusters which you are coming up with, where a lot of SMEs and the startups and the manufacturers can actually get a good opportunity to come together and walk out with a product or a proof of concept by bringing in only their talent and raw materials. So very interestingly put. So, and I know that Mr. Atantranas Gupta was also talking about the Samsung's initiatives on ITIs. I think both seem to be falling in place to create a better ecosystem for smaller manufacturers, other than what we have created at AMTZ in Andhra Pradesh. And I think we need to have more of those AMTZs, and probably not the A's, but maybe other states, MP, UP, Rajasthan, Kerala, all these places. So I think that could be another way forward. And talking of Dr. Sharma, he's actually sitting with Secretary Meti as of now, and I think he's trying to work out something better for us for the ecosystem before he can, if at all, join us. I'd like to now invite Mr. Sunil Khurana before I ask Dr. Iswar Reddy, our Joint Drugs Controller from CDSCO, to share his thoughts on the report and the way forward for the medical technology sector. So over to Mr. Sunil Khurana. Thank you for being patient. CEO, BPL Medical Technologies. Look forward to your remarks on what kind of incentives and innovations back at BPL and otherwise for MedTech. Over to you.
Thank you, Vivek. And you can call me like Pawan. You can call me Sunil.
Oh,
So
that's so kind of you. That's so kind of you.
thank you so much. And it's very good to now talk when almost 10, 12 speakers have already spoken. So, all have given a very different thought processes, and I'm not going to repeat that, but I'll try to stay as an Indian manufacturer. I'm the first probably Indian manufacturer here who's going to now talk, and I'll stay close to the innovation and indigenization of indigenous medical devices. What are the incentives should be there? So I'll just stay there. Now, there is an interesting point came from Saurabh that local market is very key. Now, why it is very key? Look at China. China has a $100 billion market. We are a $10 billion market. Globally, it is 600. So if China can be of the right percentage to their population, we have a clear scope to march toward that. And there are a lot of things which can help us. And I'll just touch that. How can we go there? So, motivation to set up more and more medical devices will only happen as market keeps growing. When I started my career in 1982, the imaging side of business is very small. It was more like a 25, 30 crore total. Today, imaging business, I'm talking those large companies, share close to $3 billion. And I'm happy that Dr. Reddy would be listening these some interesting data points. Market has already become pretty big, but probably right policies for manufacturing were not there. I mean, look at ultrasound today. Ultrasound is about 15,000 boxes are being sold globally in India. And everybody is importing. And only 200, 300 boxes are being created in India and sold from India. So that clearly gives an indication that enough can be done. But if importation and then selling is more impactful or more effective, why would you like to set up a shop here? So, those are the areas where a lot of good things have happened. Inverted tax structures have been converted. Duty structures are getting normalized. And that is where you will have a more and more local shops to come and set up. So this is one area where one has to look at things in a better way. I'm personally very happy the way PLI has come. Now PLI is going to motivate a lot. But again, look at the limits. The limits are that first year, you have to do 60 crore growth productions and things like that. In my view, and that's additional, not to start with. In my view, small companies cannot compete that. So again, PLI, while it is a great thought, it should again be now redefined. We must need to redefine it to make attractive for small, medium entrepreneurs also. Even why not even for MedTech, startups also. So that's another area where we should look at it. There was a lot of discussion about quality. I heard Piyush and many talking about quality. In India, we generally have a tendency to make a product chalta mindset. Just sell it at the cheapest way, and that is not going to work, and it's actually not working now. I can tell you that there's a very strong view. We produce a product keeping global market as a mind, not India as a market. And look at how China did. China was known for a very ordinary quality of products. Today, they make all type of product, and even product which gets accepted everywhere. Apple is making their products there. I mean, Samsung was making, and probably they have now moved their factories to different locations because of different reasons. But infrastructure got created with the help of government. Look at auto sector in India. A wonderful support in the policies came, and that helped a lot to build the auto sector ancillaries. We are talking of those ecosystems. So wonderful job was done by them. Now, quality is very key. I think that's one area regulatory bodies have to play a very critical role. Now, I don't want to say that we don't have a great regulatory team, but since everything was imported, our people have not really studied much. And the size of regulatory team is also very small. You have to have a very large team here. I mean, look at in India, regulatory team within the companies like Siemens and GE and all may have hundreds of guys who are just trying to comply how they can bring their products from outside and meet the standards. But internal regulatory team has to grow. That's one area. Second, they have to work on a speed. Very quickly, they have to work on a speed. Knowledge level. Now, knowledge need not be just built with a pipeline mode that just will keep adding and it will become knowledgeable. We can simply import that knowledge. Today, that knowledge of regulatory does exist globally so much. You go to Korea, you go to European countries, you will get a lot of information that what are the regulatory challenges they have faced over a period of time and reached here. We should look at regulatory from the point of view of patient safety, most important. If you have a good patient safety devices, if you have a product which are accurate and giving the best, whether it's an image quality or data details which you give from the analytical equipment, that is very important. So, regulatory has to just be enabler also. They have to be supportive to industry. While supportive, I'm not saying that they are just in hand and glove to make the products pass, which is not good. They should put a right framework. We all should work on those frameworks and then build the product. But at the same time, how will you export it? When China gives about 15% incentive on their export policy, can you compete with them? You can't. So government is to again look at what kind of incentivization needs to be done for products made in India. And you are going to earn dollars. You're going to get the foreign currency. So, there are a lot of things available. I am not against that. We should go quickly learn. When it comes to innovation, I can tell you that there are so much of products. There are something like 20,000 plus medical devices already does exist globally. When I started my career in 82, at that time in imaging, there was no ultrasound, there was no MRI, there was no PET CT, there are a lot of equipments were not there. Size was small globally. Now all these products were there. I heard some time back Mr. Sanjay Gupta saying that there are probably 1 or 2 MRI manufacturers. There are more than 10 MRI manufacturers alone in China. Alone in China, there are more than 10 MRI manufacturers. There are, other than this, GE, Philips, Siemens, Toshiba, Hitachi, which is now Canon and all that. So, there are more than 100 ultrasounds manufactured in China, and we have none. We have just 1 or 2 who are also making to basically export to their principal companies. So, lot can be done in my mind. Speed is something very important. And our population has to work. I mean, this 10 billion to go to 100 billion is not going to take too much of time, but right policies, right motivating policies, which has to lay the road to march us toward that side. That's another area which has to be done. On innovation, I have a very different view. When there is technology available in the marketplace, why should you do the every time, from starting from scratch? You should try to do here frugal engineering. I mean, reverse engineering or frugal innovation is what we say is actually need of the hour. And then do that, hardcore product development, as Atantra was talking that, today connected devices are going to play, wearable devices are going to play. I have no doubt in that. I mean, your vitals will be measured in the hospitals over a period of time when you're having a wristwatch, which is digital, or carrying a mobile, or having some kind of wearable that is going to monitor you, and you may get alerts. For that, home care is becoming very big. And that is where I heard probably Piyush or someone talking about that, probably Saurabh was talking that we have moved from something like average of 31 years of average life expectancy in 1947 to today 70 years. So as this aged population is going big, you have to have more wearable device, and that is the future. I can tell you, this is going to be very big. And we are an IT hub here. Our innovation team, our team who's doing a startup must focus on this area and focus on the large equipment. Only app-based product is not innovation in my mind. I mean, we have to bring both. We have to, do all of that, because if we just say that, we will not make a high-end machines, that's also wrong. But transfer of technology, I mean, Philips gentleman spoke, he's making products, but there is no need to develop here anything. You will get it from your home country or your parents, those technologies, and you can very quickly get into this. That's a challenge which local companies like us, we have. That is where some kind of subsidy for the, size of R&D team. Today, I have about 45-member R&D team. I mean, that's clearly a burden to us. So on the return of investment side, we all know that you make 10 products, probably only 50%, 40% would actually finally become a product. So some kind of subsidy toward the R&D team and what you do. I mean, we created a product with the help of, we partnered with one company, Intel, and you all know Intel. We created a wearable device, a small device which can do an ECG. But since there was no second, third company in the space, we, that really is still not taken off. Because when you go to government tenders, there is a need that there is a similar many products should come. But I have a product which can be just, you can touch around the heart. And that was a big innovation we did. I paid about 80 lakhs rupees only getting certification from the global market. Many places that product went for the various certification because that knowledge was not existent at that time in India with the CE companies. And after paying that of money, you are not very motivated because government has to come and support those true hardcore R&Ds which are being done by us. And I have no doubt in my mind that, the way telemedicine, the teleradiology, which Pawan was talking, these are all going to become very big. and we are IT hub. We should really work a lot on that. And my confidence is that given the fact that India has large knowledge-based people, if you look at the clinical people are very large. About 18-19%, both countries in US or UK are Indian physicians who are clinicians who are doing their job. So medical device was not a focus area, I want to tell very openly. I mean, before this pandemic, how many times we have spoken about medical devices? It was not much. Now you are doing it. We have already built about 30 billion, 25 to 30 billion pharma business. This business can cross that. And there has to be a lot of focus. We need to have a small group where you have multinationals, local companies, debate it out. Government body takes that information and then rules out the policy which is good for it. I'm not trying to say that multinationals, it should be versus Indian. No, multinationals can also set up a shop here. They can also do a transfer of technology with a company like us to start those collaborations. So this is what I thought I'll just share. If there is any specific questions, Vivek, you can ask, because I'm being the last. So probably most of these, subject have been already touched by our eminent panel. So I don't want to repeat that, but what I've touched is very different and just kept close to what the subject was. Thank you.
Thank you. Thank you so much, Sunil. If you insist, I'll address you by your first name. Wonderful perspective, and a reason to keep you in the last is also to, have the Indian manufacturers talk separately, and because of course we have the multinationals. And I think if you remember, there used to be India versus China story at one point of time, and then it became India and China. I think I will draw a similarity there. I think it is not Indian companies versus MNCs in medical devices. It is Indian companies and multinationals who are actually going to bring up the ecosystem, and that's what I think you and a lot of other people have given the example of the auto sector, where the ecosystem was created, and there you are, you have all the multinationals and the Indian companies working together. So that's the reason I think a chamber is an important platform where all of us can agree to disagree and disagree to agree, and bring out certain points which are good for the nation, good for the sector, good for the companies, because we believe whatever is good for the nation will be good for the sector, and whatever is good for the sector will be good for the organization. And without losing any more time, I'd like to not lose out on the wisdom and the knowledge base which we have with us, Dr. Iswar Reddy. Dr. Reddy is, as all of you are well aware, he is the Joint Drugs Controller General of India. And we would like to hear him on two aspects, if possible, Dr. Reddy. One is, what do you feel, whatever you have heard and whatever I could brief you on, what the earlier speaker said, as also what would you like to see in that report which we are making or for the medical devices sector. Over to you, Dr. Reddy.
Thank you, Vivek, for giving me this opportunity to be part of this session. First of all, let me thank PhD Chambers. The Trust and Confidence Department of Pharma has on your organization to conduct webinars and also to make suggestions for self-sufficiency and Atmanirbhar in medical technology in India. I am sure your association will submit a very detailed white paper on various recommendations how we can have self-sufficiency. Vivek, I am associated with this medical device industry and regulation since 2009. And since last 1 decade, there are so many changes in the regulations, the awareness about the medical devices, and also thanks to the medical device industry, they have done excellent job, both domestic industry as well as the importers also. They made available all technologies that are available globally to the Indian population also. You name any technology, by and large, all are available in India. But the issue is that availability is restricted to the certain areas, especially metros and other things. It is not available to the rural areas. Thanks to all the speakers, they have given their various opinions and suggestions for further strengthening of medical device industry in India. But Vivek, just, because I understand your objective is you have to clearly spell out what industry want to have a self-sufficiency in India. So I will come directly that point. Otherwise, we can, push around so many things. What are medical device, size of industry, and all these things. If you main basic fundamental principles to have a indigenous manufacturing, the self-sufficiency is first, there should be very conducive environment to set up a facilities, to conduct a business, to run a business in any environment. The conducive environment with respect to the regulations, either the regulations of medical device or regulation of taxes or regulation of price control, there should be a predictable and transparent regulatory mechanism. There should not be any knee jerks. Overnight, government should not bring some new regulation with respect to the quality or with respect to the price control or with respect to the taxes. I think the first and most important suggestion, I think we should make a recommendation through your PhD chamber is there should be a predictable and transparent regulatory system. Here again, I'm repeating, regulation means not medical device rules. Here regulation means all, including medical device rules or all various taxes or various laws, even like legal metrology, even like DPCO, drug price control order. So all the regulations which pertains to the medical device division, there should be some assurance to the industry. This regulation will be remain in intact without any change for next at least 3 years or 4 years or 5 years. Until unless any minor tinkering, I can understand from time to time government has to make minor changes, but not in the basic fundamental principles in that. The second most important point we should recommend to the government is, as you know, at present, various department agencies of government of India, like ICMR, like DBT, like MIT, Niti Aayog, Department of Commerce, DPIT, there are various agencies, they are funding industry on various areas, whether it is a particular scheme or whether it is R&D or innovation. There's many industries are giving in a piecemeal this thing. I think now there is a time has come, all these resources available with the various department, various agencies has to be pulled out. And the government has to set up one medical device innovation council, where the entire budget money goes to the one council. If required, there should be a substantial provision from the government ESPs in the next coming budget. The substantial money government should, put up in the council to support innovation. If somebody wants to do some innovation in India, whether it is a small or a big or a multinational company, they should approach this council. And it is not like, any loan or interest free or like that. It is completely, like a grant. It is not like anything. We will give a grant to you if your innovation is successful, and in the grant maybe 50%. You put 50% of money, government will give 50%. Thereby some assurance no company wants to lose their 50% share. If that innovation is successful and innovation is tomorrow is going to give the results, then they can pay back in the terms of some royalty or something to the government. Thereby that money is never depleted from the innovation council. That council should retain some money at any given time. I think that is the second important point what I would like to convey. And the third important thing, Vivek, you trust me, at least every week or two, I will get some call from the investors. They say there is a huge potential for medical device industry in India, and there is a huge market also, and investors are ready to do, but who is going to guide them? So there should be, in fact, if you ask me in India, there are a reasonably good number of people, they're ready to invest. Of course, they don't have any, maybe technology, they don't have any idea, anything, but investors are there. So now that time has come, there should be a one platform where we can, connect the dots of investor, innovator, regulator, and the government. So unless we connect these dots, otherwise all these four important pillars of this in the system, they are working in silos. So if some investor is there ready to, but there is innovator also, but there is no connect between the innovator and investors. There should be a platform where both the peoples can sit together and they can exchange their views. Yes, this is the technology available. He is the investor is available. For this purpose, what government has to do is they have to create a separate platform, and government also has to do with the help of the industry to identify what are the potential medical devices at present required for India. Or otherwise, it will be very difficult for investor which area. First, the question coming the investor is whether I should invest in the cardiology product or the radiology or any other products. So actually, we need to, we means government and all the stakeholders identify some areas of the interest, and somebody has to do some work. There is so many agencies, so many research institutes, so many, they will give the research work. Research means once you identify the products, what is the market share of that product? At present, what is the turnover? And what is the, percentage of growth of that particular category of the business? So investors need to have some background material. The size, and is there any price control for that product? What is the demand of that product in the future? So some research institute, somebody should, like Ernest, E&Y, there are so many agencies, they will do this activity for once you identify the categories. So this third point is we need to have a clarity for connecting all these people, and government should have a platform with all the identified categories of medical devices. And next, my suggestion is to promote further this innovation. Government should identify all state and central government institutions where there are facilities for testing or innovation, or they can use that facilities for even manufacturing. See, for example, if any particular medical device requires some biocompatibility testing, or some medical device requires some preclinical animal testing, I know even many medical device manufacturers, they don't know where these facilities are available in India, and whether that facilities is available or whether the facilities have with the global standard or not. If somebody will carry out the biocompatibility study data in India, the data tomorrow has to be recognized, has to be identified, has to be recognized by the international agencies also. It is not like that I will do biocompatibility in one particular laboratory. Tomorrow, nobody will recognize the data, what it is generated. So the authenticity, the genuinity of the data generated from the laboratory is also very important. So that's why government should have my important point is should have one web portal. On the web portal, all educational research institutions of state and central government, even if it is a private, should be listed on the web portal. And what each institute, they have a strength. For example, IIT Biotechnology Division or IIT Medical Device IIT Delhi Medical Device they have very good division. They are able to do a lot of testing. But many industry people, they are not aware. So similarly, Indian Institute of Science or similarly CCMB, they are very good in for developing development of the IVDs. They have good strength there. This point is including having a separate web portal where all educational institutions, research institution details are available and what tests they can do. So thereby any industry, and also the availability of the even reagents, there are some special reagents, special things required for industry. In fact, that poor guy will search entire Google everywhere where these reagents are available. Why can't in the portal identify this particular category of the product or device or is available or supplied by the so and so? So there can be a supplier list also on that. If somebody wants medical grade stainless steel, but that manufacturer has to search everywhere who can supply, what is the grade. Let that website will have, these are the suppliers or manufacturers of the particular item. So if you have a one portal having the complete details, it is easy to do the business manufacturing setup. What we have Atmanirbhar, we can achieve easily. This is one point. My next point is, as you know, Vivek, there are more than 37 departments are involved to grant 40 different types of permissions to run a medical device industry. Either you call as a license, either you call as a NOC, whether you call as a permission, whatever the terminology, everything is by and large, you are hitting with the same hammer only name is different. When so many permissions are required, either from the state government or central government, in many situations, there are no timelines have been prescribed for each and every permission or NOC or a license. You have to strongly recommend to the government, these are the various permissions required, whether it is a land revenue registration, whether it is electricity, or whether it is a water, or whether it is a boiler, whatever the various permissions are required. Industry knows what are these permissions. Let timelines will be fixed by the government. Let central government will fix the timelines in consultation with the state government. Let it circulate to all the people. Let it put in the public domain. So the industry is assured, okay, I will get all these licenses within this timeline. The major problem for the investors is, if I want to do the business, then I don't know when I'll get the license, whatever the license under the various categories. If timelines have been fixed for the each and every category of the license, you can predict your schedules of your setup of the facility, marketing and everything. And within this point, another very important, if any agency is not able to provide that license or a permission within the timeline, then there should be a provision for deemed approval. For example, any particular system says that your NOC is required within 15 days. If NOC is not granted 15 days, then we can consider that NOC is granted. So there should be a mechanism of the deemed approval. I don't know whether my next point can be part of this or it can be a separate point. Another important point is each and every state, I think you can write this as a separate point. Each and every state government must have a single contact point to address their public grievances. See, for example, somebody is not getting the electricity line, somebody is not getting the water line, somebody is not getting the land issues, or somebody is having some land order, or even sometimes the local MLA or Sarpanch will go to the factory and he will threaten them. There should be a single contact point from each state government for medical device industry. If any issue relating to the state government, he can dial that number only. Whether it is a state drug control issue or any issue. Thereby it is very easy for the industry to get it done, their work from the state government at the earliest without any issue. The single contact point should be available on the website, and then that mechanism should be evaluated. And these parameters can be considered tomorrow for their ease of doing business ranking system. It is good for the state government also. They will rank, will improve. This is my next point in that. And another very important point, we need to fill gaps at present in the regulations. Either it is a medical device rules or whether it is a Drugs and Cosmetic Act, whether it is a Drugs and Magic Remedies Act, and whatever the regulations are applicable to the medical device industry, I think we need to identify what are the gaps in this regulation and how we can fix these gaps at the earliest. And we can also recommend strongly there should be a dedicated vertical for medical device division in CDSCO. There should be a separated division with sufficient manpower. And somebody, I think why I'm stressing this point, as you know, Vivek, we have notified all medical devices under the regulation. We have notified the definition of a medical device. Thereby, all devices are going to come under the regulation. In the next phase manner, next 2 to 3 years is a very critical phase for industry and to the regulator. Either regulator tomorrow able to process the various types of applications they receive tomorrow. We need to have sufficient manpower, and also we strongly recommend that the training should be imparted to all these people, because without properly trained, if their capacity competence is not up to the mark, so they may not able to deliver the assure the quality of the product. So there should be a sufficient man. Vivek, let me know if I must have crossed 10 minutes. Then, you know, accordingly, I will finish up. Okay.
Not at all, sir. Please continue. I mean, I'm just filling pages of the notes, which will help me make the report. And I'm sure it's giving a lot of ideas and thoughts to the industry members as well. Please continue, sir.
Yeah, that's true, Vivek, because I can understand, you know, you need to recommend some concrete thing. At least, you know, if you recommend 7, 8 good points, that will, you know, be able to address a lot of issues in the system.
Right, right.
Okay. And my next point is that there are multiple agencies involved in the regulation, whether it is the state drug control, central drug control department, legal metrology, AERB, Department of Telecommunication. So how we can bring all these multi agencies in the single platform? This you know, it is not that easy. This recommendation appears to be very simple, but you know, when it comes for the implementation, every department, you know, is a Raja for the department. No Raja want to one Raja with the another Raja, they never mingle. So to bringing all this into the one platform and this thing, it is very difficult. But at least to see that there is no overlap of the regulation. This is the what underlying point. There may be a particular regulation is overlapping under the drugs and medical device rules and also legal metrology. For example, labeling requirements. So labeling requirements are, you know, overlapping between both the thing. So we need to have a single regulation for that particular. Labels means only one particular regulation is applicable. There should not be any overlap. So wherever overlap of the, you know, in the regulatory perspective are there, I think we need to be addressed that first. And my next point is, and this is actually what as a regulator I should not say, but I had to, you know, say very frankly my opinion on this. Though we have clearly spelled out various regulations for medical devices, even drug price control order, but when it comes for the interpretation varies from the officer to officer. Whether it is within my same department CDSCO or within the state government or within the NPPA, wherever it is, the interpretation of the rules, regulations is vary from the person to person from time to time. Even sometimes the same person, he will say that no, for this particular product is not regulated, for example. After 6 months, he says that no, it comes under the regulation. You require a license. So to address this issue, I think you should insist from the government, there should be a single point of contact for interpretation of existing laws. If it is a drug laws or medical device laws, you should request the government, give a one telephone number, one person, not a one agency, not an agency. That is, that person is the responsibility. He will approach the concerned department before giving the opinion. There should be a single contact for interpretation of the existing laws. Thereby tomorrow there won't be, see, this is one of the major problem investors are facing. If the investor will contact the one person of the regulatory or any other person, if you want to set up the particular factory, particular medical device, he will give some opinion. When he contacts another person is giving different opinion. He will get confused. So there should be a single contact, and that single contact person, whenever he is giving his opinion, you should give in writing, not through the telephone. You should give in writing in the form of a mail or any letter stating that this is your question, this is your clarification. Even if you want, government may think that there may be so many filthy questions, so many people will ask that without any application of the mind. What you can also suggest, let have some fee for the clarification. I don't mind even industry to pay some fee for clarification. Thereby you can reduce unwanted people just asking the blank questions without any their need. Maybe put a minimum fee. Okay, he will submit that fee and he will get the clarification. And that clarification should be a single point contact. You should not need to go here and there. I think, see, in fact, I have not thought about much, Vivek, you called me at 11:30 today. And you asked me to join just in 15 minutes before this your session. So in fact when other speakers are talking, I just made these points in the last 15-20 minutes to share with you to my views. I think at least if these are the 7-8 points, if you can articulate that point very well, just I have given only the basic principles about the each point. Then you need to give each point what is the background, what is the observation, what are the current issues, and what is the proposed solution for the each observation. I think if you propose this, I am sure your intention, what mandate Department of Pharma has given to the PhD to suggest some measures, how we can have a self-sufficiency and through Atmanirbhar in medical technology. I am sure in coming days, definitely we will get some result. Thank you, Vivek. Thank you very much. Over to you.
Thank you. Thank you very much, Dr. Reddy. I think it was, I wouldn't say quite a mouthful or a handful. It was quite a paperful also. I could list down at least 10 points, but we are recording this meeting. So if I missed out one or two, I'm sure there were more than a dozen points which you gave us. And, it's, I would first of all like to appreciate, the fact that the frankness and the sheer transparency in which you talk and give out the details which may be desired by the industry, but hearing it from the government definitely gives it a lot more weightage and a lot more credibility. So that really helps. And yes, we were trying to follow up with you to join us, but I guess you were very, very busy. And then finally, I could manage to catch you at about 11:30. So thank you so much. And I think if you've done this without really giving too much of thought and time into it, I'm sure next time if we give you more time and we push you right from the very beginning, you'll be able to give us a lot many more pointers for a report like this. And just to share with you that we will definitely be...
I think Vivek, Sunil is raising the hand. He wants to convey something. Sunil Kurana.
Yeah. No, I think Dr. Reddy, it was really amazing the way you have completely covered it. Now, my one question, and I know Dr. Jitendra Sharma has also joined. He can also probably help answer that. What is the definition of innovation? Now, innovation is a very interesting word, but if you make a product, I'm taking a simple example that if I'm making a patient monitor, A patient monitor is a product available globally for years, and you are importing and bringing that. But if we are making a product, or it's a 12-channel ECG machine, or it is a anesthesia machine, but made by us completely, will that be treated as an innovation, or something which is not existing anywhere in the world, and you make a completely new type of device is innovation? In my view, even a cost takeout initiative itself is innovation. So I thought I'll just request you to give your thoughts about it. And another question which you said, the 37 bodies are there, to give the permission, NOCs and all that. For that, I must say, now Dr. Jitin Sharma is here, is that institutes like AMTZ, the medical parks, are now supporting big time on that. You get everything done, and you go and then you can do a plug and play with nominal changes. So that has become pretty nice, more like a single point. But innovation is a definition which always keeps confusing.
Sunil, you asked a very important question. So here, I think one thing we should understand here, innovation, we are not defining innovation with respect to your intellectual property rights or patenting of your innovation. So here, innovation with respect to what we are discussing is for your existing products, how you can make user friendly, how you can make patient compliance better. See, this is always ongoing. Today, what you have, any particular machine or instrument, any these thing, tomorrow the end user, whether he's a radiologist or whether it is any other clinician, any person, his demand increases from time to time. He want more accurate, he want more easy to operate, he should give a more accurate result. So time to time, his demand increases. As demand increases, he will ask you to change your your design, or you change your model. It's such that it will achieve the full efficiency. I think so. Innovation, whether it, even for example, somebody will develop a completely new device for any particular diagnosis or any particular, for example, therapy. That is also innovation. And also innovation is also, for example, typical some disposable syringe. You make such a small any changes such that it won't have a prick and it will be better disposal. That is also innovation. But only thing is that in medical devices, without having R&D and innovation set up, it is very difficult to run the industry. It is not like a pharmaceutical industry. Pharmaceutical industry, if you go on manufacturing paracetamol tablet last 100 years, still today paracetamol tablets you can manufacture and you can sell. The tablet will be the remain same. The active ingredient is the remain same. Sometimes your excipients also remain same. But in case of medical devices, like everybody will give example like your mobile, what you have a mobile features today, tomorrow, that may not sufficient for the consumer. The every day, if you see 3 years old models of mobile, you won't get in the market. It is a very dynamic products. Medical device industry itself is a dynamic industry. So until unless it is, this industry is back supported by R&D and innovation, it is very difficult to survive. But however, this innovation R&D back support, not necessary you should have at his own manufacturing facility. He can utilize, like as you said rightly, in the various parks, they have come up with various setups like AMTZ and various educational institutions. That is what I have suggested to the Vivek. Identify the educational institution strengths, what facilities, what they can offer for the innovation, what they can offer for testing, how we can utilize that facilities for the medical device industry. I'm very happy to share you, many state governments, they are so much interested to set up a medical device parks. I think when this Department of Pharma has advertised, to asking the applications from the state governments, if I rightly understand, 16 state governments, they have submitted application for the park. And all 16 are serious players, not just for the, just for the shake, the name shake, they have not submitted the application. And also, I heard from some of the state governments that even if they are not able to get the central government support through the Department of Pharma for to set up this medical device park, even they may not able to select it, still some of the state governments, they want to set up the medical device park in their state from their own budget, even without, in case they are not selected from the central government under the Department of Pharma scheme. So this clearly indicates how both state and central governments are very serious about this medical device industry. Thank you, Sunil.
Very, very heartening. Very good. Thank you so much. Very nice.
Thank you. Thank you. Thank you, Dr. Reddy.
Vivek, if any questions, I can take up. Then otherwise, I will have some other.
Yeah. I see Mr. Tantra Das Gupta also raising his hand. Over to you for a quick question.
Yeah. First of all, thank you very much, Dr. Reddy, for coming up with the point that's common interpretation, single interpretation, which we are facing a hell amount of problem today because there are different interpretations. And secondly, you picked up a very important and pertinent point on testing. Apart from the biocompatibility index, I think the standards, the parameters, the tables of India specific has to come up, because today we are relying on the Western tables, Western parameters, and our diaspora, our demography is not well represented over there, and the diagnosis suffers. Thank you.
I agree with you, Mr. Das. I think, as you said rightly, some of the medical devices, what it is developed abroad, their physical anatomical conditions may differ with the Indian conditions, Indian thing. And definitely these things we as a regulator at the time of approval, we will take into consideration, and accordingly we will insist the additional information data for that particular device.
Thank you very much.
Thank you.
Dr. Reddy, excellent presentations. I just have, one of the points which is like an impact of the NELM, like the National List of Essential Medicines. Like we've seen that, that some of the products, again, like DES, which is the medical devices, are also, under these list of NELM. So what do you think is the impact? Like, are we going back to that, or we give it freedom to more medical devices? That's the questions, normally is being asked by the industry.
That is the reason, Dr. Harvinder, I said very clearly, there should be a transparent and predictable regulatory system in India. Whether it is a quality regulations or whether it is a price control regulations or any tax regulation, there should be some predictable mechanism. That is what, I have suggested in my first point. Government should assure this. Okay, next, up to this period, this is the policy. We are not going to change the policy for the next 5 years. Thereby, the industry will make their mind.
Right.
So I think government is also discussing some other mechanism for the price control. I think many industry people may be aware. So I think this national list of essential medicine at present, it covers only very few medical devices under that provision. But definitely, through the PhD platform, if you request the government, let have some policy which will give assurance that next 5 years, this policy will be applicable, and we won't change that policy during the 5 years period.
Right. Thank you. Thank you so much.
Very important. Yes. So if you have 2-3 more minutes, maybe I can ask. There are two hands raised out of the attendees.
Sure.
So I am allowing Mr. Sumit Agarwal to speak. Please give your introduction and ask your question. Mr. Sumit Agarwal. I think we can't hear him. I'll just go down to the next person, Dr. Kamal Krishna Banik. Dr. Banik, please unmute yourself. I have allowed you to talk. I think there's some problem in getting them to hear us, or maybe they are hearing us and we can't hear them. Okay, okay. We have Dr. Jitendra Sharma joining us while Dr. Reddy was talking. So, Dr. Sharma, I think you had a marathon meeting with the Secretary Meti. And would you like to share some details and also your thoughts on the topic for today?
No, thank you very much, Vivek ji. Can you hear me?
Yes, we can hear you.
Excellent, thank you. No, I'm glad I had an unplanned meeting, which was a rather long one on other aspects, because as you know, medical devices is quite unique and at the same time quite diverse. Unique because every device generally does only one action, one act. A surgical instrument helps you cut, or artery forceps allow you to use it on anatomical layers. The radioisotopes work on contrast. The radiology works on imaging. The N95 mask works as a layer for breathing cover. So every device is functionally very unique. But if you look at the entire spectrum, medical device is one of the most complex sectors, simply because it has too many categories of things. Right from an ultrasonography machine that works on piezoelectricity, to a flat panel detector and scintillator based MRI system, from a spun-bound melt-blown fabric-based mask to electrical cautery, which is more electricity and cutting and coagulation-based phenomena. Now, there is no sector which perhaps can be as complicatedly packaged as medical devices sector. It's very complicatedly packaged as a sector itself. Anything which is non-pharmaceutical in nature and is a product-based intervention in healthcare generally tends to be a medical device, barring few commodities that are packaged as vaccines, biologicals, and blood products. Even that blood product, the blood storage bag, is a medical device. So the thing is, we are group of dissimilar entities giving an impression of homogeneity as a group, which it is not. And our biggest challenge in the genesis is without perhaps medical devices sector truly represents what India is. You have 300 languages that a country can manage, or continent can manage, with just one. We have about 300 languages and 2,800 dialects to do the same thing. The most part of the world can manage with one new year, which is on 1st Jan. And we have about 16 new years, ranging from Pongal, Happy Sankranti to all of you, to Diwali, which is in Gujarat. Perhaps this dissimilarity packaged as an entity is our uniqueness as medical devices sector. Now, coming to what are the three major portfolios on which we would like our approach. Now, one is research. Now, if somebody were to work on a heart-lung machine in Sri Chitra Institute or in AMTZ lab, we are fortunate to have a funding for it. But if Mr. Sunil Khurana were to work on the same heart-lung machine in his factory, I have no support for him. Now, what kind of discrimination of science is this? Finally, the heart-lung machine is not going to either serve me or Mr. Sunil Khurana or Mr. Vivek Sehgal. It's going to serve a patient in Indian hospital, and if we are lucky, patients globally. then in the genesis of that science, why are we discriminating just by the nature of institution? And if we were to say that this discrimination is part of our protocol because government institutions can be audited, then I would defer, because private institutions are audited by a whole lot of more things like GST, input credit. You can name, and in terms of structural probity, private institutions are not out of the gambit. They are as much accounted for and audited for as much as a government institution is. So my point number one, which can go in the recommendation that you would engineer and architect, Mr. Sehgalji, is we must have a national MedTech R&D fund which does not discriminate between public and private institutions or labs and factories. Because these research work, innovative work, will not be secluded to one kind of an institution, which also brings me back to answer the question Mr. Sunil Khurana asked. And I picked up his example only because of the question he asked. And that is, what is the definition of innovation? Now, an innovation is defined depending upon the stakeholder who is asking the question. A venture capital firm would have a very different definition of innovation than a regulator. A regulator will simply say what is not a predicate device is an innovation. A venture capital fund would say something that gives you a CAGR of 15% and has a potential competition index less than 0.1 is an innovation. An intellectual property expert would say something on which you can file a patent is an innovation. And an health economics person or an industry chamber would say something that can reduce the cost of product or cost of care is an innovation. So the stakeholders nature, the nature of the stakeholder who is asking the question gives the answer of what innovation is. And this is a question, this is a puzzle, not just medical devices industry, but a whole lot of other sectors like automobiles, green engineering, renewable energy across the world are grappling with. Because every time the question maker changes, the answer changes. And you have to fit into that definition every time your effort. So if something like principal scientific advisor to Government of India, who is an extremely high ranked individual and a stalwart of great scientific merit. Currently, Dr. Vijay Raghavan, before him, Dr. R. Chidambaram, and the lineage going right up to Dr. Kalam himself, almost the father of many sciences in India. The principal scientific advisor to Government of India could have an R&D fund of say 1,000 crore, cutting across multiple departments like DST, DBT, DHR, DSIR, CSIR, ICMR, and I can continue to name those departments, our friends and colleagues in those departments that work very sincerely towards this. But the principal scientific advisor to Government of India could have 1,000 crore fund in supporting innovation in medical devices, which does not discriminate between Sunil Khurana and Jitendra Sharma, which does not discriminate between Trivitrons and BPLs and Transasias and Sri Chitras and AMTZs. A fund which looks at the potential impact of a product more than the applicant would solve the game for a long time, because we are a 60,000 crore sector. And if a country can't spend 1,000 crore per annum on research, we perhaps have lost the battle already. So I would like to ask straight away, because see, many people can talk and get away. Some can say what we should be doing, whereas it is they who should have done it 5 years ago. And we can still say we should be doing this. And I'm still saying we should be doing this because I didn't do it myself 5 years ago. So today I stand and say I should be doing it. But finally, what fuels an economic cycle is funding. And we should have 1,000 crore fund straight away for medical devices research and innovation, which equates all applicants in a similar manner. Number two is we do have multiple regulators. I agree with that fact, of course, and most countries have it. Most countries have a different regulator for radiological devices, which is registered under International Atomic Energy Agency. Most regulators have a separate vertical for IVDs, as we do. Most vertical, we have a validation process through ICMR. Most countries have it. So we are not uniquely disadvantaged. We are not. The reason we are uniquely disadvantaged is by our inability to converge. See, when I apply for a visa, I go to VFS Global. Now, it doesn't matter whether I apply for Turkmenistan or Tajikistan or Norway. Most visas can be done in the Shivaji Metro Station VFS Global office or Nehru Place VFS Global office. And when I apply for a visa to any country, I actually get acknowledgement from that country's embassy, VFS, but my visa is processed by that country's embassy. And we have VFS only to collect charges and manage the distinct approval pathway of visa by the respective countries. And I think the biggest lesson our regulators can learn is from VFS Global. If an entity can manage 134 countries and can give you a single tracking number, which you can use for tracking your application of visa until you get your visa and can store your record without duplication, why can we not manage 12 regulators? We have 12 major regulators of medical devices in India. State by far are far more advanced because they do give single window clearance of non-regulatory industrial infrastructure like water, electricity, and so on. That is not something our scientific regulator should worry about at all, because they neither have an understanding of it nor the capability to provide for it. The states are doing it excellently well. What our regulators must understand is the scientific regulatory pathway they must converge to without losing their respective mandates. So while CDSCO can follow the SUGAM, AERB can follow the ELORA system, each regulator having its own regulatory system, these regulatory systems could converge not into a common regulator, but on a common regulatory filing platform through which traceability is assured, duplication is avoided, and the lead time of processing between multiple regulators is cut down because you have taken care of the duplication. 12 regulators need not ask the name of my company and ISO 13485 certificate 12 times. They should ask what pertains to their regulatory framework. And therefore, it is not about reducing the mandate of the regulator, but actually converging the mandate of the regulators into a common regulatory platform. And the third one, which more is a sign of liberty in society, is that convergence and consultations. You see, the government should do this, the government should do that, etc., etc., should happen only with consultations, right? So if you see the last 3 notifications in India in which medical devices have been notified to be regulated, none of them have had a transparent, publicly announced industry consultation. So it's not what you do is important, is how you do, which is also important. So while we are talking of a 5-year predictability, to be honest with you, we don't even have a 5-month predictability. We don't know what will get notified in May or June, as we did not know what got notified 2 months ago, 6 months ago. And therefore, I think every single large, impactful regulatory move should be backed by a publicly announced, YouTube uploadable, live consultation with industry stakeholders, And we should not get away by saying we have a structure to take a consultation through a technical advisory board. We have a structure for this, we have a structure for that. Yes, we have structure, but we need to allow people to get into these structures, right? And their opinions. And therefore, my three submissions and thoughts is one, 1,000 crore R&D budget for industries to do research and innovation, because unless we fund their research, there is no point talking. All of us can talk for years. It will not help a genuine manufacturer even a bit. And we all can give good SOPs, but if we don't implement a single of that SOP in our daily life, we are good talkers, not good doers. And therefore, 1,000 crore budget for R&D is a must for a 60,000 crore sector and growing. Number two is learning from VFS Global and institutions within the government like FSSAI. You think medical devices industries are anyway larger in number than the number of food products we have or the number of restaurants this country has? No. But FSSAI has been able to give a number to every single food item, from a sauce to a chawanprash. Every single item has an FSSAI number, and every restaurant in India, even on Swiggy, has an FSSAI number. Why are we not able to even copy our own brethren sitting in FSSAI? And therefore, my second point is to use structures like FSSAI and VFS Global for medical devices, converging multiple regulators within their mandates only on a platform without touching or reducing or modifying their respective powers and mandates. And my third point is to have a mandatory, transparent, ethically convened industry consultation before any large regulatory moves. Because every large regulatory move, after it is done and it has already adversely impacted the industry, we can absolutely sound friends and give a wish list of things to do, having missed the bus. And it is we who drive the bus. So we must ensure that none of our passengers miss it. We should drive it well. We should drive it with consultations. With these 3 points, I of course agree to my all previous speakers and happy to answer and take questions and add on my thoughts.
Thank you, Dr. Sharma.
Vivek,
that we do stand by the fact that all the circulars and the changes in the regulatory provisions done by CDSCO, we have been a part of those discussions as industry chambers and industry. So there is no disagreement on that fact at all. And whatever is being said by Dr. Jitendra Sharma, I can probably vouch for him and say that it is not pertaining to CDSO, but umpteen number of other regulators.
Absolutely.
Like you also talked about 37 departments, with 40 different, regulations to be taken up. So that is definitely something which, again, we stand by. And we want to thank you for, more than 10, 11, 12 suggestions which you have given us, as to what can be done to actually further the development of this sector. In fact, the first two, Dr. Sharma, which you talked about, I think you may have missed Dr. Reddy's conversation at that point of time. He was the first one to actually talk about this. He called it a Medical Devices Innovation Council, which needs to be made, which is on similar lines as what you're talking about, the research and subsidy support, which he said should be given to innovators, to people who want to work in the innovation side of it. And in fact, the second one, where you talked about convergence again, Dr. Sharma, which is something, again, I think, which was point number 6 or 7, when Dr. Reddy briefed us that, this is convergence of regulators is a must, which we should do, make sure that there is a lot of predictability. And predictability was his first point when he actually talked about the things to be done for this particular report. The first point mentioned by Dr. Reddy was about predictability, bringing in predictability. So I'm seeing Dr. Reddy coming from a very, very proactive and very, very helpful I would say, suggestions which can actually grow
No,
the sector,
absolutely.
which is good for the
Absolutely.
country, which is good for the sector, which is good for individual companies, and good for the
Right.
globe as well, and the global healthcare ecosystem. So with that, I'd like to, with folded hands, thank Dr. Reddy for being here. I'd like to also thank Dr. Jitendra Sharma, Dr. Atantra Das Gupta, Mr. Sunil Khurana, and a lot of other speakers who have left. I thank all my participants who have stayed that long. And because we cannot thank you enough in words, I have my co-chair of the Health Committee, Dr. Harvinder Popli, to propose a kind vote of thanks.
Thank you, Vivekji. And I think it was a very, very interesting session. So good afternoon to all of you. On behalf of PhD Chamber, so I would first like to thank our guest of honor, Dr. S. Iswara Reddy, Joint Director, CDESCO, for sharing his views with the industry and his continuous support, which is shown by the government in the industry. And so many valid points, which he has added and he has mentioned. And, it's so much well appreciated and is given a food of thought to all of us, to write about it. I would also like to thank our panelists of the sessions, starting with Mr. Sanjay Gupta, President ESIMA India and MD, Mars Edpal Instruments Private Limited, Mr. Piyush Kaushik, Head Healthcare Innovation Center and Business Leader, Philips India, Mr. Atantra Das Gupta, Director, Southwest Asia, Head for Samsung HME, Mr. Saurabh Arora, Head of Tax, Asia Pacific Siemens Healthineers, Mr. Sunil Khurana, CEO of BPL Medical Technologies, Mr. Pavan Chaudhary, Chairman and Director General, MTL, and Managing Director, Vigon India, Dr. Manish Diwan, Head Strategic Partnership and Entrepreneurship Development, BIREC, and Dr. Jitendra Sharma, who is the MD and CEO of AMTZ. And also Dr. N. Subramaniam, Chair for our Health Committee, PHDCCI, and Director with the Medical Services of Indraprastha Apollo Hospital, and Dr. Sameer Gupta, who is also my co-chair with the Health Committee, Director of Cath Lab Metro Group of Hospitals, for sharing his thoughts and innovative ideas with the industry and sharing their views on various government incentive schemes to make India self-reliant. And also, thanks to Mr. Vivek Sehgal, Principal Director, for organizing such a wonderful webinar and, bringing in a battery of speakers, so many of a learned speaker at one single platform, which is not a one-day job, I think, he really deserves recognitions for that, for bringing all of them together. And our distinguished industry members, students and delegates, without which this webinars will not be complete. And I'd also like to thank the Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, Government of India, for their continuous support in organizing such webinars, conferences, and the knowledge sharing sessions for the growth of the industries. We are also thankful to Indraprastha Apollo Hospital, for sponsoring the webinar. And, we had a very, very fruitful discussions. And, one of the point which I just wanted to add is that, all the speakers has also led that there is a need or developing the MedTech ecosystems. So there is, from our industry sides, I surely see that, what all the speakers has told, and as also mentioned by Dr. Reddy, that there is need for formalized training programs to connect with the industry. And we can surely have an academia, which is of utmost importance for the life-saving medical technologies or healthcare sectors. If you see the countries such as US, they have an active board called NIH, which is funded by government and which operates through the 27 institutes, each with a specific agenda of research, and it also provides the training opportunities with itself. And similarly, we have a global examples of a Seoul National University hospital in Korea. As we all know that, in medical technology, Korea is very a leading country. And they had tied up with the large healthcare institutions to set up the MedTech incubation centers to promote the new development, prototyping, etc. So we can have such an ecosystems which provide ready access to patient populations for samples, doctors for inputs, clinical engineers at a single locations, and also provide a specialized training for biomedical staff in the niche area of expertise, products areas which provides opportunity for such engineers to be either absorbed back or a manufacturing industry or in the hospitals. Similarly, Singapore is also a MedTech import dependent economy, has a similar model where a star agency for which is called Science, Technology and Research, and EDB, like Economic Development Board, they come together to focus on providing training to a medtech industry on a specialized skill sets. So they have invested in such models and also the ecosystems to enable them to become hubs for the R&D and manufacturing in future, and also encourage the several startup ideas. We are all talking about innovation, so that has been, and that will together culminate into a indigenous medtech systems, which is the need of the day. And there is enough voice raised for the standards and compliances. So we also need to have, there is no ecosystem and infrastructures to conduct the level of quality testings similar to CE or FDA, which is locally. So ultimate goal is to innovate and develop it locally, and manufacture and procure it locally and service globally. So all we need is the right framework in place to achieve. So government is also doing a lot of things. So I think the Dr. Jitendra TAZ is doing a lot of things in this stuff, and the Gujarat government is next coming up with this FDCA. So with this kind of a background, and since already we are at 2 p.m. So not taking much of your time, and I would really like to thank all the once again the Department of Pharmaceuticals for supporting all the dignitaries present for their valuable suggestions, and definitely, as Mr. Sehgal has mentioned, we'll take up all the points which is suggested in the webinar, and we'll be submitting the report to be complete after the series to the ministries. Thank you again. Thank you so much.
Thank you, Dr. Copley, for a very deserving, warm vote of thanks, and with that brilliant idea of how educational institutions and the industry can come together on a very pertinent point where Dr. Reddy talked about the vertical division being created, for the medical devices within the regulatory bodies with sufficient manpower is put in place. So and plus they are definitely trained. So I think that's, and you coming from educational institution, I'm sure you'll be able to drive this for us at the chamber for the benefit of these regulator as well as the industry. So marathon session, 3 hours, we hadn't budgeted for it, but thanks a ton for all the attendees, participants who stayed back listening to all this tremendous knowledge which has flown since morning. I think we'll have a long time and a hard time assimilating this in the form of a report. My hand folded thanks to Dr. Ishwar Reddy, to Dr. Jitendra Sharma, to Dr. Tantru Das, and Mr. Sunil Khurana for staying right till the end. We couldn't have asked for more. And thank you so much, and wishing all of you a very good health and prosperity in 2021.
Thanks a lot.
Thank you so much, sir.
Thank you, sir.
Thank you.
Thank you.